I'm Valerie Fletcher. I'm the Executive Director of the Institute for Human-Centered Design, and I am thrilled to have a crowd this morning to share this experience of why it matters, sharing stories of tackling ADA transition plans. I want to acknowledge that we have both American Sign Language and CART available this morning. And we have Julie and Beth on ASL. We have Karen and Teddy on CART. I trust that you know how to turn that on so that you can see it. Our ASL interpreters are both spotlighted, so you should be able to see them. We are not going to drown you with slides today. I want to put that right up front. We are going to show very few slides. People were invited to show slides if they wished, our presenters, but you probably will see no more than 4 or 5 slides in the whole morning. So no worries about that. This isn't that kind of day. This really is a day about listening and talking. And why are we doing it? And why are we doing it this way? I mean, part of it is the IHCD and the New England ADA Center are deeply committed around the value of ADA transition plans. And we actually believe that it's an important opportunity, even almost 33 years after the passage of the ADA, to give people a sense of action and opportunity and inspiration to do this all-important transition planning that can really make an enormous difference going forward. And a reminder that this notion of civil rights is one that in the United States was born of the 1964 Civil Rights Act, and the ADA had to add accessible design in order to create an opportunity for non-discrimination and equity. And that's something that we should be very proud of. It's been picked up everywhere in the world now, but the United States was the first. We know that the lofty idea of the ADA can get lost in the complexity of standards and regulations. We know that intimately, and I know many of you do too. It can make it hard to take a first step when you are an organization, an entity like a municipality with responsibilities. It can be tough, and it's too easy to put it aside, but it's too important not to act. We want to help you figure out how to make steady progress, because that's what we've witnessed. And that's what we want to share with you through the stories that are being told by our colleagues and friends who are going to share their personal stories of their own municipalities. There's nothing more important for all the important environments in which this is a critical responsibility. Somehow there is something so precious about making it work where you live. So it may be less grandiose than stadia and higher ed and schools. It's your local town, and it's really when it works, it changes your life. So today our goal is just to share stories. We think that stories are a more efficient way, an effective way than grinding on about telling you about your responsibilities, which we do often enough. And we find that most folks really do want to change the world for the better. That's not a new idea. That's not hard to find people who are motivated by that. But we want to give people a sense that this is something that is a vehicle for changing the world. And I want to make it clear that we know what we're not doing today. This is a small first effort. In all the cities and towns that we're going to be showcasing today are in Eastern Massachusetts. There are many others creating great stories too. And we're not taking anything away from that. We just wanted to begin. We too wanted to act. And this is not a detailed map of what you have to do. That's for another day and other vehicles. We do have a website, www.ADA Action Guide, ADA ACTIONGUIDE.org, that is actually kind of the detailed map of what you need to do. And this is really New England. And I want to invite our director of the New England ADA Center, Dr. Oshie Harrison, to share a little bit about research that the center has done to really find out where we are on implementation of these transition plans that have been required for so very long. Oshie, Could you step up, please?
Good morning, everyone. Thank you, Valerie, very much for inviting me today, and it's wonderful to be here with all of you. My name is Oshie Harrison, and I'm the project director of the New England ADA Center. For those of you that are new to us, the ADA centers, there are 10 of them across the United States, and we all provide information, guidance, training, and do research on the ADA. So thank you all for being here. Today, I'm going to talk to you a bit about the research that we've done with cities and towns. And the name of that research is Identifying Challenges to Implementing the ADA for Municipalities in New England. And the New England ADA Center, with our state affiliates, surveyed 934 cities and towns in New England to identify challenges to implementing the ADA. Based on our survey results, we provided interventions to determine how best to eliminate those challenges. And then we resurveyed the cities and towns to see if there was an increase in the implementation. So our survey questions were based on 3 larger, major research questions. We wanted to know, in what areas is implementing the ADA a challenge? 2, what factors impeded municipalities from implementing the ADA? And 3, could we create an intervention that lifts all municipalities up 1 or 2 steps closer to compliance? So we focused on survey questions around administrative requirements, and those were 5. 1, is there an employee who handles ADA compliance? 2, is there a municipal complaint procedure that includes ADA issues? 3, does the municipality notify the public about its compliance to the ADA? 4, has the municipality conducted a self-evaluation of programs and policies? And 5, did the municipality develop an ADA transition plan? We also had survey questions about services, programs, and activities. For example, do you have accessible polling places? Is there an employee who arranges accommodation for effective communication? And does the municipality have an accessible website? So when we asked those questions, like, does your municipality have an ADA transition plan? We offered 3 possible answers. You either answered no, or yes, or I don't know. If the answer was no, then we asked, tell us why. Was it lack of money, lack of personnel, lack of time, lack of what the ADA requires, that knowledge about what the ADA requires, or was it something else? So here were our results on the first round of surveys. Of the 5 administrative requirements, the self-evaluation and the transition plan was the least likely to be completed. Now, this is probably no surprise to our guest storytellers today, and no surprise to many of the people who are attending this today. Of the services, programs, and activities, accessible websites were the least likely to be completed. And the primary causes for non-compliance was lack of personnel and lack of knowledge of what the ADA required, tightly followed by lack of money. So we decided to do our intervention, and our question around that was, can we create an intervention that lifts all municipalities 1 or 2 steps closer to compliance? We went for the low-hanging fruit, actually, and this is how we did it. Very quickly, we did email blasts to all municipalities with our link to our data on disability for individual states and cities. And this included types of disabilities, disabilities by race, and disabilities by age, and a link to our ADA guide, our ADA action guide for state and local governments. Then half municipalities received a how-to information about how to create a notification of compliance, how to create a grievance procedure with a link to sample forms in the ADA Action Guide. The other half of municipalities received a how to do these guides and notification and the grievance procedure and notification, and they received an invitation to a webinar on how to plan and conduct a self-evaluation and a transition plan. Our second round of surveys then happened about 6 months later, and the results were similar. Of the 5 administrative requirements, this time it was just the transition plan that was the least likely to be completed. And of the services, programs, and activities, again, it was accessible websites were the least to be completed. And of the primary causes, once again, for noncompliance was lack of personnel and lack of knowledge of what the ADA required, followed tightly by lack of money. So the overall results for the ADA Center, it seemed to us that we could solve this problem with sharing knowledge about what the ADA required for cities and towns throughout New England. But it wasn't enough, because what we did not increase compliance. So our lessons learned in this, our biggest lesson, was instead of providing information on how to comply with the ADA, our focus should be on how to engage municipal representatives with what the ADA requires. The challenge for us is to get buy-in from municipal representatives for using the ADA provided information. So in this sense, the precursor to assisting municipalities to implementing the ADA is the development of relationships between municipalities and those in the position to help, whether those in the position to help are within the state or within the region. And this is what we will get to hear about today in the sharing of stories about tackling the ADA transition plans. I will leave you with, you can read more about our study. We have a white paper on our website, which is newenglandada.org. And the title is Identifying Challenges to Implementing the ADA for Municipalities in New England. And we have an interactive app there also where the research results can be found. I'll also put the links in the chat. And I just want to thank everyone for being here today and to keep up the good work. Thank you.
Thank you so much, Oshi. And I want to make it clear that today we have a rather unique set of municipalities because they all happen to be in the Commonwealth of Massachusetts. And there's a reason for that. Massachusetts has made a commitment to state funding. It's now in its 7th year. A previous director of the Massachusetts Office on Disability cajoled our former governor, Charlie Baker, into adding a line item to the budget that would fund municipalities to develop ADA transition plans, and even an additional line item that would fund capital project subsequent to the submittal of a full plan. It's not large, but it has proven to be invaluable. And that is a story that I would like to have Mary Mahon Macaulay, Director of the Mass Office on Disabilities, tell you about. I want to also note that the Mass Office on Disability is our New England ADA Center's Massachusetts affiliate. So we've been very proud of that phenomenon. But boy, all we really want to see is some replication that short money at the state level can make enormous difference. So Mary, tell the story of what you folks have been up to.
Sure. First of all, thank you very much, Valerie. Can you hear me okay?
Sure can, Mary.
Oh, okay, great. Thank you for inviting me to share here. And this is really important stuff. And thank you to IHCD for running this program today. So as Valerie said, my name is Mary Mahan McCauley. I'm the Executive Director of Massachusetts Office on Disability. And we have a municipal ADA improvement grant that we present to everyone and allow Massachusetts municipalities, any city and town within the Commonwealth of Mass can apply for these grants for either a self-evaluation in transition plan, a planning grant, or a specific project grant. So the amount that we've had for this is for last year, which the cutoff for the grant was at the end of September. We opened them up at the beginning of August and they end at the end of September. This is an annual grant that can be applied for. Last year, it was $3 million. And this coming year, which will be FY or fiscal year 24, that begins in July 1st, we will be opening up the grant cycle again, the beginning of August, and the amount goes up to $4 million. So we truly have the commitment of the governor's office. We have the commitment of the entire state to increase this grant actually by $1 million up through FY 27, fiscal year 27. So at that time, it will be $7 million. And I know that I am interested in trying to include more funds into that grant because as a matter of fact, this year, as I said, it was a $3 million amount. We received $11 million in asks. And that was for both planning grants, which we'll be talking a lot about today, as well as project grants. So to break it down specifically, this past year or this year, we had 22 planning grants and 24 project grants. And we were able to fund pretty close to our full $3 million. And it's been so exciting. And the thing that I really want to stress in my last 30 seconds or so here to speak is that you need to really have a self-evaluation plan. A self-evaluation transition plan is needed first. You cannot start with the project plan because you need to have a self-evaluation and transition plan. You need to have ADA coordinator. You need to have people to go around your city or town and look at what types of projects are necessary. What do you have to put in this plan? What needs to be done to make sure that your municipality is accessible and programmatically as well as physically in the built environment to the individual disabilities that are residents in your cities and towns. So, you know, I'm really interested in looking forward to today's presentations to really hear some information, and a lot of it from Massachusetts, but, you know, states all over the United States that, you know, some of these planning grants and how people are presenting them so that, you know, we individuals with disabilities around the country really will have more access to what we should have access to, which is all the rights that any other person or resident within the country, within the city, town, or states have. So glad to be here today. And if I can help with answering any other questions later on, or if you want to reach out to Massachusetts Office on Disability, it's mass.gov, gov/MOD. And our website has a lot of really great information. So thank you very much, Valerie, and back to you.
Thank you, Mary. Really appreciate it. Now, you've made probably quite a number of people proud, and that's exactly what we hope. I want to just let the audience know that if you're interested in the actual work that was done by our 5 presenters today, we have actually provided the URLs for their plans, so you get a sense of the level of detail that they developed. I want to just quickly go through the order of the day so that everybody is clear. And the municipal presenters, of course, are the bulk of the day. They will be 30 minutes apiece. We will begin with the town of Barnstable, and the presenters will be Tammy Cunningham, the ADA coordinator, and Paul Logan, chair of the Barnstable Disability Commission. At 10 o'clock, we will go to Michelle Tyler, director of planning for the town of Randolph. 10:30, I will go to Lisa Camerata, who is the ADA coordinator for the city of Salem, along with Deborah Lopsitz, who is chair of the Disability Commission. At 11 o'clock, we'll move to Melrose. From 11 to 11:30, it'll be David Hoff, chair of the Disability Commission in Melrose, and Garen Boyd, the deputy or the assistant director of the commission. This is the one presentation today that will have been originated. The project was originated by the Disability Commission. And we will close out in presentations this morning with Janet Nicosia, who is Director of Facilities for the town of Andover and has been deeply invested and involved in this from the very beginning back in 2017. We then have a panel of all of our presenters will be together in a panel from 12 to 1 to really take questions from the audience. I'm hoping that this is really a wonderful dialogue of being able to bring practical questions, strategic methods of getting buy-in from the senior people in your municipality, where the political implications, how to play this. So we're hoping that that's a lively discussion. I'll be moderating that discussion. I do want to let people know there will be no specific breaks. I urge you to take a break as you can. We are looking forward to a busy day. We have just a few minutes before Barnstable begins. We'll give you 3 minutes to go refill your coffee cup or take a break, and we will begin Barnstable at exactly 9:30 with Tammy and Paul. So we will join you again in just a few minutes. Thank you.
Good morning.
Hang on one second, Tammy. I just want to take a second to let people know that if they are driven to come up with questions to ask you as you begin, that they should put them in the Q&A whenever they are inspired to do so. We'll just gather them all up at noon. So without any further delay, let's introduce Tammy Cunningham, ADA coordinator for the wonderful town of Barnstable and its 7 villages, and her compatriot, Paul Logan, who is chair of the Disability Commission, both of whom equally involved in the entire process. Take it away, Tammy.
Good morning. I hope everyone can hear me okay. Thank you, Valerie, for inviting us to speak this morning and to share in Barnstable's process on the development of our plan. I'm really excited to share our story about our success and continued success in this area. As Valerie mentioned, I am joined today with Paul Logan, the chair of the Barnstable Disability Commission. I am going to share my screen and put up a slide which just gives you it's our 7 villages in the town of Barnstable. It's a thumbnail portrait of each of the villages, which kind of gives a visual of the unique charm and character of each. And just to give you some information about familiarization of what our community looks like, the town of Barnstable is located in Massachusetts on Cape Cod. I'm sure each of you are familiar with Cape Cod. And so we are located on the Cape. We are a heavily designated tourist area, which means that it's a destination community with a heavy emphasis on tourism. The visitors coming from all over to visit our beautiful seaside community. Barnstable is located in the Mid-Cape region of Cape Cod and is the largest town on Cape Cod. The town of Barnstable is home to 7 villages, with each village having its own charm and quality, making each unique and special in its own way. The 7 villages incorporated in the town of Barnstable are Hyannis, Marston's Mills, Osterville, Barnstable, West Barnstable, Hyannis, and Centerville. Our year-round population, and this is as of the 2021 census, is 49,853 visitors. And in the summertime, this triples because that is the season in which most of our visitors will come to visit Seaside Cape Cod. We have 450 miles of roads, 80 miles of sidewalks. One of the more telling statistics of our community is that for Barnstable County, which is the county with which the town of Barnstable is located, from 2010 to 2021, Barnstable County saw the largest increase in the age group of 65 plus, increasing to 36.7%. And this was the fastest growing demographic for the county of Barnstable. Specific to the town of Barnstable, with which I'm presenting today, our population is 65 and older is 21.7%. And this information is important to our community because we know as individual age, disabilities become more of a natural occurrence. And we always want to be sure that as we're building our communities and we're shaping and planning, we are doing so with a very thoughtful approach to accessibility and inclusive design. And this will allow for our visitors and our residents to be able to enjoy all of the amenities that we each work so hard to instill in our communities and promote. As Paul and I talk about the Barnstable transition plan and what our success is, we view it as a perspective as it's part of our journey. It's not an endpoint. It provides us critical information as to where we've been, where we're going, and what our future looks like. But it's important to identify that we view it as a journey and not as a final product. And before we get into discussing more about the elements of our transition plan, I would like to first mention the assistance and support that has been provided to Barnstable by the Mass Office of Disability. They're an incredible resource for those on the call who are in Massachusetts and have not connected with MOD. I highly recommend doing so. I have contacted them for difficult questions pertaining to accessibility and getting some guidance and support. And they always are there serving in any capacity that they possibly can as a resource. And I cannot emphasize this enough. Barnstable, actually, our plan, our journey, which began in 2021, began because we were able to receive grant funding by the Mass Office of Disability to begin the work of our ADA self-evaluation and transition plan and having that completed. And as I mentioned, this happened in 2021, which was the height of COVID. There is somewhat of a rapid turnaround, but we were able to get the work done and accomplished it very, very well. And I'm very proud of that. I'm going to transition my slide to a different slide. And the slide before you right now are what we identified as 8 key contributing factors of what makes our plan successful. And when Valerie invited me to speak, and I thought about the success of the Barnstable Transition Plan, as well as our ADA self-evaluation plan, and what made it all possible, it was difficult to identify one leading factor. There were so many pieces, as well as multiple layers that came together that needed to be invested in this plan for it to be able to work. One of the highlights of the 8, and I'll go ahead and read them off just to give an idea, but the 8 we identified was the support and vision of senior leadership, communication and transparency, collaboration, engaging with citizens in the business community, planning and budgeting, the role of the Disability Commission, the ADA coordinator, and the role of policies and procedures. And when we look at the 8 key factors for the success of our plan, the one that stands out prominently for me as the ADA coordinator and the shepherd on access, if you will, as well as the leader, is the support and vision of senior leadership. And I cannot emphasize this key enough. And that's simply because of the fact of the role that the senior leadership plays in making sure to identify what the community's view is on access in the community, as well as how it's going to be received in the community and throughout your internal organization. It's incredibly important that this is communicated throughout so that we all have an understanding of what this means to the community and the priority that it plays. One of the things that we are proud of in Barnstable is that from the very beginning, when we embarked on our journey of applying for our ADA planning grant to be able to complete the self-evaluation plan and the transition plan, our town council and our town manager from the very beginning was a champion of this project. They were incredibly supportive. They were constantly communicating this plan out to everyone that they possibly could. So everyone had an awareness of where we were, what we were applying for, and what our hope and vision was for the community. And as I mentioned, this is incredibly important. And one of the other pieces that we have in our community that I think is incredibly helpful is our town council. We have a liaison from our town council that actually serves on our Barnstable Disability Commission. So throughout any questions or planning relating to accessibility, they attend our monthly, our monthly meeting so that they are there to hear what's happening in the community, identify if there are areas that need to be addressed, where items are of importance to begin to address, as well as to communicate back to the town council what is happening in our community as it relates to inclusive design and accessibility. And I am going to turn it over to Paul Logan so he can speak to the role of the Disability Commission and how they serve as a critical component to your success.
Thank you, Tammy. And many thanks for being invited today to Valerie Fletcher, Executive Director at the Internet IACD, as well as to the Massachusetts Office on Disability, who Tammy mentioned earlier, allowed us to do this grant project through the town of Barnstable. Thank you for the funding. I've worked with, as Tammy mentioned, IACD for the past couple of years. We have in the town of Barnstable. And I've worked personally with the Massachusetts Office on Disability since 1986 in another town in Chelmsford when I was on a disability commission for 10 years there. Some of the key points and the best contacts, in my opinion, after working with IACD and the Massachusetts Office on Disability, are we've got 2 wonderful organizations. You can add to that the New England ADA Center. And those 3 groups are shining stars in the ADA compliance long 33-year program. as chair of the Disability Commission in the town of Barnstable, and for all the other disability commissions around the state of Massachusetts, as well as in other states, it's key to have a strong disability commission working towards the goal of the ADA and self-evaluation transition plan. Fortunately, there are a number of folks who join me each and every month when we have meetings on the Disability Commission. You can't be a shrinking violet, as Tammy mentioned earlier. You have to be able to have the ear of the town manager, a mayor in your city or town council, city council. You need to be able to, I hate to say the expression, but make some noise, make your role as the advisory committee in your city or town heard. And in order to do that, you need to make sure you've got viable folks on the Disability Commission who have a varied interest. And that's one thing, fortunately, the town of Barnstable has with its role of the Disability Commission. And I'm a proud member of the Disability Commission in the town of Barnstable, and working with Tammy Cunningham, who we just heard from, has made it a perfect partnership. And in that instance, where Tammy has a position as the Assistant Director of Human Resources, great things happen with the application process through the town, to the contracting with IHCD, after the award that we received from the Massachusetts Office on Disability. And from the beginning until the end, you have to have a strong disability commission working with the city or town that you live in. I'll throw it back to you, Tammy.
Thank you, Paul. For the next factor that we wanted to speak to was communication and transparency throughout the development of your plan, particularly in the rollout, and making sure that all of your residents, visitors, and those alike are aware of where you are in the process. And this piece was really important to us in Barnstable, as we do have a very participatory dialogue with our communities. We invite comments and feedbacks about how we're doing, where we're doing things right, where we're doing things wrong. And throughout the entire process, we were always putting out information about the status of the plan, the awarding of the grant, the creation of the transition plan. It was disseminated throughout our organization so that all of our departments and division heads have access to their plan, so they can identify properties within their respective areas of expertise that need to have deficiencies corrected and need to have greater access. In addition, it is housed on our website. We did a really fantastic job of putting out information about our plan. And one of the things I'm most proud of that it was a direct result of our ADA self-evaluation and transition plan is we actually placed on the homepage of the Town of Barnstable website an accessibility tab. And within that tab is going to house all of our information pertaining to accessibility in our community, relating to our town-owned properties, as well as programs, services, things of that nature. It has all of our legal notices, ways in which one can apply for an accommodation, for a reasonable accommodation, as well as information on our grievance procedure, all of your legally required notices, and it has a direct access to our ADA self-evaluation plan and our transition plan, which we're really proud of because we want to promote the information. We want to make sure it's readily available and accessible to anybody that has it. We also made copies of the documents to be placed in all of our libraries and town buildings. So if somebody is not able to access it over the internet or on our website, they are actually able to go to a public building to view the plan. It's important that the information is disseminated and it's transparent and everybody knows where we are in our journey of accessibility in our community. And Paul, I will turn it back to you so you can speak to the role of the ADA coordinator.
Sure, thank you, Tammy. We're preaching to the choir here when we're talking about ADA coordinators. I'm looking to see all the folks that are signed in from not only Massachusetts, but New England and all around the United States. And I've had a unique opportunity to be involved with the beginning of the commissions on disabilities in Massachusetts. For the 10 years that I lived in the town of Chelmsford, 1986, represented the first of my 10 years on the Disability Commission. That was the very first year that the Massachusetts Office on Disability set up or initiated the ADA commissions, committees with commissions within each of the 351 cities and towns in the state. Not every town took advantage of it. Fortunately, the town of Chelmsford did, and you get to see who's interested in making access better, and that goes to Valerie's points earlier, which is key. The ADA has been around for 33 years, and I prefaced it by several years in the town of Chelmsford. The ADA coordinator in each and every town, in my opinion, and the opinion of the Disability Commission, must be somebody who's actively engaged. And I'll say there are occasions in cities and towns, not only Massachusetts, but all around the country, that they many times ask someone to do it as an additional job. Or, hey, if you have time, could you please do this? How many hours a week? It depends. If you've got a strong ADA coordinator, and I'll explain the story of Barnstable in a minute. If you've got a strong ADA coordinator, that makes a huge difference. You've got the ear of senior management. If that person does their job correctly. A lot of times it's the HR director, the director of facilities, town manager in some towns is the ADA coordinator, especially in small towns that have set this up. At the same time, it doesn't matter where you are as long as you work the job. The ADA coordinator in the town of Barnstable, I've lived here 25 years, had been the HR director. That person did a wonderful job. And the good thing is, with the grant that we received from the Massachusetts on Disability, is that's a mouthful, is when we have a change in anything, and this plan that we were presented with allowed us the opportunity to go out and do a real deep dig into what does the town of Barnstable need to do to get better. I think the town of Barnstable has done a great job in the 25 years I've lived. I know we can get better, a lot better. So this plan identified areas systematically, programmatically, as well as access-wise that needed to be upgraded. And there's a lot to do. Tammy mentioned the process as far as the plan, where we have it located. And I kept promoting that we need to do more. One good thing is we've had the luxury of having Tammy on the Disability Commission in the town of Barnstable for the past 19 years. And with Tammy's position as Assistant Director of Human Resources, she's the liaison to the Disability Commission and has been for 19 years. Tammy became the ADA coordinator, in my opinion, much as a result of what she's done, not only with the Disability Commission, but also with this project. This project that IHCD we contracted with, we've identified so many things. It's a living document. It's not a document to be put on the shelf. It's a document to use and to use wisely as we go forward. Huge who the ADA coordinator is in any city or town all around the country. It needs to be somebody who works the job, not just an extra thing you do for 4 hours a month. Can't emphasize that enough. Now it's back to Tammy.
Thank you, Paul. To speak to the role of policies and procedures in an organization as it relates to a community is also a critical planning part of the process, because again, it shapes and forms your community around the programs, the services, as well as all of the amenities that your community has to offer and how residents and visitors are able to access them. When we started looking at how we can incorporate and weave policies and procedures into our organization to better emphasize and promote inclusive design and especially inclusive design, as well as the fact that we wanted to be forward thinking. We don't want access to ever be an afterthought. We should always be looking at policies and procedures from the lens of access and inclusiveness. And one of the things that we did in Barnstable that I was very excited about, again, and there's many things that excite me about this plan. I take this work very seriously and I'm very passionate about, what we do in our community to promote accessibility. But one of the things that we have is we do have a formal event planning permitting process. And it's been in place for many, many years. But when the transition plan and the ADA self-evaluation plans were completed, we identified that maybe we needed to be better in this area. So it wasn't only the town that was promoting access, but we wanted our vendors and those that were utilizing our town properties to also be taking a look at accessibility for their program participants and those that were going to be partaking in any events that were going to be planned. And so through the event permitting process, there are a number of sign-offs that happen, and that includes police, fire, health, licensing, any of those where you just want to make sure that the venue is being promoted very responsibly and all avenues are being addressed the way in which they should be to make sure it's healthy and safe for everybody. And we actually added an accessibility sign-off on all of these permits. So as it stands right now, as a permit comes in, I, as the ADA coordinator, will go ahead and review the event to identify where is accessibility that could be included in here, make sure that handicap parking is not blocked and there's no obstacles, so it's free for use with those who have a valid placard and plate. Is the event inclusive in that it's promoting if somebody should need an accommodation, or there's a way in which it needs to be modified for everyone to participate? Is that happening? And that's my role that didn't happen prior to this, that I'm really happy to say happens now, because now we're able to have this dialogue from the very beginning of the permitting process, as opposed to after the fact when something may arise that causes one to be able to not participate or prevent an event from happening. And that's something that we are really proud of the work in that piece in terms of policies and procedures. And I would say that that's just, again, part of our journey of where we need to be better in policies and procedures, but we're continuing to build on that and look at other ways where we can include it into other policies and procedures in the town.
Okay, I'm going to discuss planning and budgeting right now. And that would be am I on the screen?
You're here, we can hear you.
Specific to items that we had learned from the Institute for Human-Centered Design in Mass Office on Disability, in the stage that we were at working on this grant. And as Tammy mentioned earlier, the town of Barnstable has many square miles and is huge compared to other cities and towns in the Commonwealth of Massachusetts. And in looking at the planning and budgeting for any community, we received a $250,000 grant from the Mass Office on Disability, which was the maximum. When you look at the magnitude of the town of Barnstable, where we've got approximately 40,000 year-round residents and 1,100 employees within the town, working for the town of Barnstable specifically. There's a lot of money that goes in and goes out. And we fortunately have had the ear, as Tammy mentioned in her opening, of the town manager and the town council. And if we're not getting the ear of either, it's up to the Disability Commission, the ADA coordinator, or the liaison to the Disability Commission to speak up. We've got a community that has needs, as any community does. In the town of Barnstable, we've got the buy-in from the town manager top. You have to have that buy-in to make any disability commission work, any ADA and transition plan. You need that. As many cities and towns go about implementing the changes needed to come up to full access. I mean, it does start with the process of what are the prioritized needs. You need the town to have capital monies available. In town of Barnstable and other towns in Massachusetts, it's a capital improvement plan. You prioritize it by each individual facet within the town. And again, this comes down to not only a town with 40,000, but perhaps the city of Boston with millions. You've got small towns all around Massachusetts and every city, I'm sorry, in every state in the nation. And if it's a 12-person town, 12-person employee a group within a small town in any part of this state that you live in, let's make sure they have an ADA coordinator, because you need to have that person working with the town. Question came up on the Q&A, is there a cutoff level as far as needing an ADA coordinator? I can't answer that. I'm assuming that Massachusetts Office on Disability can, perhaps they'll chime in. We've made inroads not only in the town of Barnstable, making sure that the DPW, Recreation Department, any department that requires not only the physical access that Tammy was just talking about, but also the program access to make sure that the HR department has monies and has plans in place to make sure that we have equal access. And I don't know if it was Oshie or Valerie that mentioned it early on. We need equal access to every other citizen in your community. Back to Tammy at this point.
Thank you, Paul. Sorry, I was responding to a question in the chat. The final piece that I just want to mention that I think is incredibly important, as well as you're going through your transition plan and your self-evaluation plan, is the need to collaborate. While I am the ADA coordinator for the town and I'm considered to be the point of contact, I'm not an expert in all things, and I never would profess to be. And it really took a team of individuals to contribute to the success of our plan, as well as the continued success of our plan. From the beginning of our work with MOD in terms of being able to secure the funding for the plan, to our work with IHCD, who has become an incredibly valuable resource to me as I continue through the journey of accessibility. Finance for the budgeting of our projects. DPW has actually designated an engineer so that they actually always have their hands on the ADA transition plan and are always looking to prioritize and identify the needs, and that can be incorporated in our budget. The Disability Commission, who's always there supporting, promoting, lobbying, prioritization for projects that need to be addressed. And it's a critical element for the success of a plan, and really accessibility in all communities, to be sure that there's always there a collaboration with the experts coming together to identify how to address everything that's taking place within the plan. And I'm going to stop sharing my screen. And I would just like to give some kind of words of wisdom, if you will, as you're looking to either continue on your journey for applying for a transition plan, or perhaps you have one and you're not sure where to go next. I think it's important to understand that it's a snapshot of your community, and it's how to make our communities better. It identifies to us where we are, where we've been, and where we need to promote and do things better than we are, which is something that Barnstable takes great pride in, and always looking to make ourselves better. We're a progressive community. We're always looking to be a leader. Accessibility is one of those things now that we're really hoping to take the lead on. The other thing is I think sometimes communities could be intimidated by the element of identifying what you'll uncover as you go through the plan. But I think it's important to identify the fact that you might learn that there's a lot of things that your community is doing incredibly well. And I know that when we went through our project, there were things that we could be better at, but we also uncovered things that we were doing very well, such as outdoor dining. During COVID, this was a huge element of being able to build communities and come back together. Outdoor dining was one of those things that was highlighted as we're doing one of those things right in a very good and thoughtful way. And there were other things, but that was certainly one of our highlights. The other thing is that you listen to the stories of all communities, and I'll end here, is that just know your community and what will work for yours, because what worked for ours maybe won't work for yours. Or maybe there's a couple of things from our discussion today and information that Paul and I described to you that you could take away, and that would be helpful to you. So thank you so much for sharing today with us and listening to our story, and best of luck to you with your journey on accessibility.
Thanks so much, Tammy and Paul. Really terrific. We urge everyone to take advantage of the destination of Barnstable, the town of Barnstable, and all it has to offer, and all the ways in which they have made that something that's available to absolutely everyone. So thanks very much. We're now going to move to a place that has a very different set of challenges, and that is the town of Randolph, very close to Boston. And Randolph is distinguished as a town that has become extraordinarily culturally diverse. And we are very fortunate today to have Michelle Tyler, who is Director of Planning for the town of Randolph. And I want to just, before Michelle begins, I just want to acknowledge the excitement of Michelle's depth of understanding of this process before it began. That I think as a dyed-in-the-wool planner, she understands the sequencing of tasks and the importance of it, and how to put your arms around all of it at one time. She has had to deal with very different challenges, particularly around issues of communication, when part of her community is defined by the status of immigration and English as a second language. So Michelle, if you would step up, please.
Well, thank you, Valerie, and good morning, all. I will start by saying, especially for my New England colleagues who are looking at the weather, that after the presentation by Barnstable, where I've learned so much, I feel like there may be a road trip to the Cape necessary this week. So Barnstable, look for me on your doorstep on Friday. Thank you all. Let me tell you a little bit about Randolph, Massachusetts. And we're a dynamic community located about 15 miles south of Boston. For those of you familiar with the area, that means it's probably about an hour-and-a-half drive south of Boston, as opposed to just 15 miles. Over the last 3 decades, our community has evolved from a typical New England bedroom community of about 30,000 people. The demographics at the time, 8% of the population identified as Black or African American and 5% Asian, and that's from the 1990 census. Currently, we're a vibrant and diverse community of 34,000 people, where 42% of our population identifies as Black or African American, 15% identifies as Asian, and 37% of our residents are foreign born. And that's it from the 2020 census. We are from many backgrounds with many different perspectives and lived experiences. And we consider ourselves to be the quintessential 21st century community. Our unique diversity requires that our local government be a willing student to exhibit flexibility and adapt to our residents' needs as our demographics change. We understand that effective communication on our behalf is crucial to our residents' ability to access municipal resources and participate in municipal processes. Access is a fundamental equity concern. We know that in a healthy community, citizens actively participate in municipal processes, whether that's through voting in local elections, serving on local boards, attending public hearings, and being involved in civic organizations and community activities. But how does the municipality facilitate that? It is only recently that we started to ask ourselves how to bring local government to people where and when they are most comfortable interacting with us. We started to ask ourselves, how can we best connect and communicate with residents and develop methods for outreach and information digitally and on paper in multiple languages? What we haven't done is consistently ask, have we considered communication efforts and methods other than written or spoken language? Or how do we ensure that residents of all abilities can access our services and programs? We don't have strategies for incorporating access and inclusion training for our staff and onboarding staff members. Last year, I was charged with facilitating the town's application for community development block grant funds. That funding would provide support for our low to moderate income families for housing rehabilitation and childcare assistance, much needed in our immigrant community as they're adjusting to their lives here in the US. So when reviewing the requirements, there was a question, do you have an ADA self-evaluation and transition plan? And I stopped. I have no idea what that is. I don't know. Do we? Does anyone in the municipality know if we have an ADA self-evaluation and transition plan? I have no idea. I listened to Oshi as she was speaking at the outset and mentioned how to engage municipal representatives to learn about ADA requirements, self-evaluation and transition plan. And I thought, well, aren't I just the poster child for that? Because I have no idea. Which said, well, I guess you'll need to learn about that, Michelle, since I couldn't find anyone in the municipality who had information. So I started to investigate. And my reaction in learning about ADA self-evaluation really was, in the polite terms, are you kidding me? This has been required for how many years? And we haven't done it as a municipality? Why? I don't understand this. We do have a disabilities commission, so what's happened? My approach was to reach out to the disabilities commission. And I started that outreach in the summer of 2022. And at that time, I learned that the longstanding chairperson had resigned after probably decades of service to the town. Volunteering can get exhausting. Any of you who serve on a board, committee, or commission understand those obligations can sometimes be tiring. At the same time, another member had resigned and another had passed away. So our Disabilities Commission wasn't even able to reach a quorum for meetings. They were finding challenges in attracting new members, and here we are almost a year later, and they still haven't been able to attract new members to serve on the commission. However, I did reach at least one member who has been around for about 30 years and talked about the need for the self-evaluation and transition plan, and they just said, you know, just do it, get it done. We're fine. Come and see us somewhere along the way, and maybe we'll have enough members in the commission for discussion. I do understand that at various points over the last 20 years, the Disabilities Commission had tried to engage the municipality in creating a self-evaluation and transition plan, but there wasn't a strong municipal champion. There's that municipal knowledge piece that Oshi mentioned, and the comments from my colleagues in Barnstable of needing a strong municipal champion. There wasn't responsibility or oversight for the project. Well, whose job is it? Is it the Disabilities Commission to acquire the budget and do the procurement and oversee the plan? Is it some municipal department? No one could answer that. And then there's the money. It's always about the money, isn't it? I'm going to come back to the money, I promise you. So we started our journey. We had to commit to conducting a self-evaluation and transition plan in order to receive the funding from community development block grants. I told you it would come to the money. In order for us to receive those funds, we had to do a self-evaluation plan, no problem. So it became my job to facilitate. I don't know if that means I'm now the municipal champion, but I'll wear that hat right now. I'm happy to take that on. But it also meant I had a lot to learn. So Valerie mentioned that I came with knowledge. That was me learning. That was me going through MOD. That was me going through the New England ADA Center and starting to read on the laws and take seminars online so that I could become knowledgeable and speak effectively to my colleagues. There was so much to learn, and I know I haven't learned probably half of it, and certainly not as much as those of you on this seminar who have been engaged in this work for decades. I'm 1 year into this, maybe 2 years into this. So we did complete a procurement process, and I was lucky enough to engage with IHCD to help with our self-evaluation plan. And I learned even more from Valerie and the team during the course of self-evaluation than I probably did on some of the seminars that I've taken. We are just now in the process of concluding our self-evaluation and have gone out for public comment. I do want to share one of the comments that was made by the former chair of the Disabilities Commission once he resigned and learned about the ADA self-evaluation plan. And he said to me, I just about did a break dance on the family table. I have been advocating for a transition plan for the town for over 2 decades. What happened? Did the town secure funding? Why now? Glad to hear this tremendous news. I was so excited to receive that, but also a little sad that 2 decades for something that's been necessary and in some cases required for at least that time. And it all came down to funding. Now, I will also tell you that at the time, I had no idea that the state was providing funding for self-evaluation plans. I said, we have a municipal budget. We should just pay for this work. It can't be that expensive to pay for the review for self-evaluation and transition. Incorporating those changes to become compliant is another story, but I had no idea. This goes back to Oshi's comment about municipal knowledge and awareness. Just said, you know, here's the budget. We're just going to do this because it's the right thing. Our challenges in going forward are the intersection with culture. We have so many languages and cultural backgrounds in our community that the approach to municipal government alone provides challenges. If you have come from a country where you do not have comfort level with your government, and now you're here and we're trying to reach out to you, that's challenge number one. Challenge number two is cultural approach to disabilities. And within that approach to disabilities is even the use of sign language. I see we have ASL, but I do understand that there are other methods of sign language in other cultures. So how do we reach all of Randolph? How do we ensure that our concept of one Randolph reaches all of those folks in order to be engaged in our processes? Another example of our challenges with just our community, Section 203 of the Voting Rights Act outlines methods for communicating voting responsibilities and voting rights when you have a single language group that reaches a certain threshold. Put it simply, last year during the election process, all of our ballots and all of our voting information needed to be presented in 2 different languages, English and Vietnamese, side by side, not separate documents. So for those of you who may have remembered in Massachusetts, the very long ballot last year during election, ours was even more intense because one side was in English, one side was in Vietnamese. So I think we actually had a 2-page, 2-sided ballot. Also requires interpreters on site. And again, that cultural intervention with municipal services. And that's separate from making sure that we have screen readers on site, etc. We're at the point of finalizing our public comment and incorporating into a final report to be presented to our legislative body. We have a city form of government, so I do have a city council. I know we use the word town in our name, but that's not uncommon in Massachusetts. And we will present it to them. My goal in that presentation and in the follow-up discussion is to establish policy systems and environment changes related to ADA accessibility. Policy to include changes in policies through ordinances, resolutions, mandates, and regulations that guide and direct all of our municipal departments, programs, and services to ensure that they're incorporating the concept of ADA accessibility in their work. Barnstable gave a phenomenal example of for event planning that there's actually a sign-off that has been considered accessibility. Our systems would involve changes made to the rules within an organization, and that would work hand in hand with the policy changes. And our environmental changes would be the changes made to the physical environment, including structural changes to programs or services, and social changes such as a change in knowledge or behavior about policies. During the conversations with my colleagues in Barnstable and with Valerie and Oshi, again, there were discussion about staffing and does the municipal staff understand ADA access? Is there an ADA coordinator? Well, first and foremost in Randolph, there's not one. Again, a year ago, didn't know that one was needed. And there's still not one until we work through this transition plan to figure out who's the best person, who then will need to have training to become competent and capable to speak to not only our residents, but our staff. And communicating with our staff when we do have residents who need some type of accommodation or interpretation assistance. We're not even at the point yet of being able to interpret language, oral language. Our challenges in reaching other type of accommodations such as audio assists or ASL, even work in Braille. We're, I won't say light years away, but we're further away than that. Our hope, or my hope, is that the ADA self-evaluation plan will lay the foundation for long-term sustainable strategies for Randolph to impact and expand equity and access. But for Randolph, those strategies must intersect with culture. We need to understand how disabilities are perceived in the many cultures that live in Randolph, so that we can best provide support to those experiences, those experienced living with those disabilities in their culture, to ensure that they have access to the municipal services, programs, and resources that they need to live in a healthy community. I am very excited to be a part of this process, and I am happy to be the champion in Randolph. I am hopeful that our Disabilities Commission will expand their membership. I met with them less than a month ago, and their membership, 2 of their members are brand new. So the concept of ADA self-evaluation was as new to them a month ago as it was to me a year ago. So we have a lot of work to do. And I think that's I'm a good foil for the presentation that Barnstable did, who, although I think we started around the same time, Barnstable is already leaps and bounds ahead of where Randolph is. And that's okay. That's the kind of the point of some of this webinar, is where we're at in our journey, where we start and where we end. And we're nowhere near the end of the journey because there shouldn't be an end. This self-evaluation and transition plan should not be a nice report that's closed up, put on a shelf, and gathers dust until someone says, oh, do we have a self-evaluation plan? Is it somewhere? It's one to actually guide and direct our day-to-day activities with our municipality. I am not going to take up your 30 minutes. I am going to conclude here, which gives you all an opportunity for a break as well before our next speaker, Valerie.
Michelle, I'm just going to keep you for a couple more minutes, partly because you represent a really critical aspect of this work today. As you say, you are a 21st century city, particularly in your extraordinary transition to the level of diversity that is normal now in Randolph. And I think one of the challenges that all of us need to understand is the ways in which to communicate with people who aren't familiar with the basic concepts of civil rights and human rights in many cases, and have attitudes towards disability that can make the whole process of a commitment to equity and non-discrimination mysterious. And I think we all know that that is partly about how we talk about things, what kind of language do we share. And this is something that I know the New England ADA Center and ICD are looking at very, very aggressively, and doing a lot of research on, and doing a lot of testing, and finding to our significant discomfort that a lot of the language around the ADA is extremely difficult for people to understand, who are not lawyers, who are not people who are familiar with this language and may not be familiar with the concepts of that language. We have been testing basic ADA information off the ADA website with a team of people from a variety of cultures who have lived experience with disability, and finding out that pretty much not a paragraph quite makes the goal of being information. So how are you dealing with that, Michelle? Just wondering if this is something that you've begun to get to. How do you even talk about a vision of equity and rights for people coming from cultures where this is pretty foreign?
We are still learning how to do that. And part of that is our discussions and going to where our residents are and trying to embed ourselves to learn. We have to ask. Frankly, the best way for us to get information is from our youth, is from our younger residents who, while they may be first generation, they may have been born in another country and emigrated here. They are more in tune with Western culture and American process, and then I'll narrow that down to Massachusetts as well. So we have found that our youth are our ambassadors. That is where we can get information, understand better, and in turn provide them information that they can bring back to their parents and grandparents and distribute that information in a mechanism, in a method that's culturally relevant. And we actively work with youth councils. We've created a youth council regarding health and wellness, where students are working with us again to help us understand where we can provide information to the community. And that's just regarding health and wellness, physical health and wellness, and then mental health and wellness, certainly over COVID. So our approach has been with the young people.
That's an incredibly important piece to share. And I think one that everybody will be listening to. I mean, I think one of the things that we found in a variety of places is that parents of children with disabilities often are much more attuned to the phenomenon of rights in the United States, that notion of equity, that notion of non-discrimination. So they have, through the experience of parenting a child with disability, they learn about these things and understand the asset that represents. But I love that idea. I hope that you are able to recruit some of these youth ambassadors to your disability commission, because it seems to me that they could be really vital drivers of change.
Absolutely.
Thanks very much for sharing that. Now we'll give people a little bit of a bio break, or a little bit of a chance to catch a breather until we begin again on the half hour. Thank you, Michelle. This has really been terrific. Really appreciate it. And we earnestly hope that you were able to get an ADA coordinator that has something of your fire in the belly. Welcome back all. We are now turning our attention to the fine city of Salem, Massachusetts, another destination town, as well as a terrific town on the North Shore, one of the oldest towns in all of America. And I want to introduce our two presenters, and that is Lisa Camarata. Lisa, are you there? Lisa is the ADA coordinator and also has enormous responsibilities on the HR front for the city. She'll actually have to be leaving us at noon for negotiations with one of their significant staff groups. Can we elevate Lisa? And are you there?
Can you
Can't see you.
say technology sometimes is not my friend? Can you hear me now?
We can hear you, we can't see you, and we can't see Deb.
Okay, my screen is, I have my video on.
Okay.
I hope you can hear me.
We can, but we cannot see you either.
I have a message saying that the host has, okay, here we go.
There you go. Okay.
Okay.
Very good. All right. All right. Thank you, Lisa, and thank you, Deb, who chairs the Disability Commission in Salem. Before you begin, I just want to acknowledge that Salem had a very important asset at the very beginning of your development of the ADA transition plan, which was your mayor and the mayor's commitment. So Mayor Kim Driscoll of Salem was just an incredible cheerleader right up front. Having a powerful mayor kick off the process meant that every single department head was present. And it makes us especially glad here in Massachusetts that Mayor Kim Driscoll is now Lieutenant Governor Kim Driscoll, which bodes well for the future of attention to these issues in Massachusetts. So take it away, Lisa and Deb.
Thank you, Valerie. It's good to see everybody, and I can tell from the chat that you can see us now, so that's exciting. Yeah, thanks for having us here. Deb and I are actually very excited about this. And I will just sort of dial back. It's interesting you mentioned the mayor. Those are usually our big bragging rights here for Deb and I. You know, we get to say not only did we get to work for her, now she's elevated. So I'm wondering, like, I'm going to probably play that for about another 6 months to a year, and then I think, you know, I might have to stop that. But all kidding aside, Valerie, thanks for the introduction as well. I am the Human Resources Director for the City of Salem. I've been here for like 15 years, I think. And in that role, I'm also fortunate to be appointed as the city's ADA coordinator, and that allows me to be the liaison to our Commission on Disabilities. And with me, we have Deborah Lobsitz, who is, she's turned out, you know, not just a board member from the Commission on Disabilities, she's our chair. She's also become an incredible friend and a terrific colleague. She's retired from the Mass Commission for the Deaf and Hard of Hearing. And I have to just tell you, she's a huge asset to our group. She's going to fill us in a little bit about the city of Salem and certain things, but I do want to say it's pretty tough to follow Randolph and Barnstable because you guys gave terrific presentations. And a lot of what you've said, I'm actually encouraged, comforted, and I'm excited that we kind of all went through a lot of the same things. And I think as we start talking about some of this, Deb would probably, Deb will, obviously throw some things in as well. We've, some of the things that you've talked about, your barriers and the different things that you've gone through are very similar, if not almost sometimes right on point to some of the things that we went through here in Salem. So Deb, you want to tell them how wonderful it is here in Salem?
Sure, I'd be happy to. And but I want to start by saying I too am very grateful for the opportunity to be here and participate in this. It gave us the occasion to do some reflection, and I'm happy to report that that was a very positive experience. We don't always sit down and work through what we've done over the past years, and it really bolstered our enthusiasm and confidence to see that things are working and we're moving in the right direction. So I'm grateful for that opportunity. I'm also delighted to hear the comments of the previous speakers and to see how succinctly some of you have been able to put together all the elements that go into executing a successful transition plan. Salem, I'm sure, is more familiar to many of you than most places. It's a tourist destination. We have people from all around the world visiting here, and in a very concentrated period of time. We have visitors all year long, but as you know, when Halloween rolls around, it's a little bit like our Mardi Gras. And that puts a different kind of pressure on us with regard to making things accessible, and it keeps us honest. So Salem was first established in 1626. It was incorporated in 1836. Our current population is in the neighborhood of 44,000. Of that 44,000, 1,500 of our residents are veterans. We have 14% of our population as foreign-born individuals, and 16.2% of our population is 65 or older. 8.5% of our population is made up of people living with disabilities. We all know that those numbers are generally very reported, and our experience, our day-to-day experience proves that to be the case. We're also a city with many, many historical, not just sites, but regions. The city being the age that it is, our streets are narrow, our sidewalks are terrible. We have cobblestone pavement and bricks all over the city. And we have two very active historical organizations that really want to keep the historic nature and presentation of the city intact. And you are all aware that that creates a conflict oftentimes for accessibility issues. We work with them. I'm happy to say that we actually have a friendly relationship and consult with each other back and forth on appropriate solutions that will respect the historical features of our living space, while at the same time providing full access to every individual who would like to enjoy those particular sites. The Salem Disability Commission has been active for a long time. I actually can't even tell you when it began, but about a decade and a half ago, I was working at the Mass Commission for the Deaf and Hard of Hearing, and as part of my training, I was sent to the community access monitor training that was scheduled to take place in Salem. And that was when I met the members of the Salem Commission on Disabilities, and they immediately extended an invitation to me to join the Salem Commission on Disabilities, and I have been very happily involved ever since, and am grateful that the commission was so active from the beginning. However, we were facing some challenges, one of which was we were experiencing sort of this silo effect, where the commission met regularly and members were very enthusiastic and active, but we didn't have quite the sound networking with the rest of the city government. And that is significant in that after we had our transition plan done by the Institute for Human-Centered Design, the very first thing was this enormous jump in awareness on the part of every department in the municipal government in Salem. And not only was the awareness raised, but everyone was engaged at a very cooperative and compassionate level. So we really didn't come up against a tremendous amount of resistance. People were enthusiastic about getting on board. As Oshie put it, the buy-in was there, and it was a let's work together buy-in. And I know that doesn't happen everywhere, and I'm just so grateful that it's going on here. So that transition plan for us I was thinking about how to phrase it, and I was coming up with, it gave us a guidebook, it gave us a roadmap, and I realized that really kind of dates us. Perhaps what I should say is the transition plan provided us with our YouTube instructional video on where to go from here, because it's a big, big job. The evaluation itself and the resulting report brought in a spirit of cooperation and also a sense of hope that we could do this. It really, you know, making the city accessible is an overwhelming job, and it's an ongoing work. And we really had the support and had the whole approach reframed for us by getting it down on paper and having a list. Having a list is empowering. So it was very educational, but it was also mobilizing. I think maybe from there, Lisa, do you want to put any more in there before I start highlighting specific impacts?
Yeah, I do actually. That's a great story so far of what's happened here, because you're like 100% right. I lived it with Deb, and she is. That's exactly how it sort of evolved. The interesting thing is, I wanted to say the road to getting to our transition plan was a little bumpy, right? I can certainly identify with Michelle from Randolph when she said, you know, do we have a plan? What is a plan? Like when I was attending our Commission on Disabilities meetings, I had sort of heard, oh yeah, we need to do an ADA transition plan. Oh, I think we did one several years ago. Oh, check with the school department, or I think it's here, or I think it's there. And so, you know, I'm being very honest with all of you, because I think some of you may be sitting there saying, oh yeah, we've been sort of hearing about that, but what are we really talking about? And so I didn't really know. And then I would ask, and I would sort of get a few responses, and I just sort of knew somewhere in the back of my head that it was something we needed to, you know, sort of tackle and sort of face and look right in the mirror and realize that we needed to do something. And then it was never more relevant when we decided to apply for a MOD grant, when Mass Office on Disability, as Mary spoke earlier, offers the different grants. There's the project grant and the planning grant. And so the first year, I believe we applied for we did a project grant to make one of our sections of our playgrounds where we had a pickleball court, and that whole area, we wanted to make it accessible. And we applied for it, and we had everything ready, because as you know, when you apply for the grant, you need to sort of have pretty much everything ready to go if you're awarded it, so you can move quickly on it because of the time frame. And so we did apply for it. It was a terrific project. It wasn't, you know, it wasn't unaffordable. It was actually pretty reasonable, and we were awarded the grant. Part of submitting for the grant, of course, are all the boxes you have to check. And, you know, do you have this? Do you have a grievance procedure? And do you have an ADA coordinator appointed? And do you have a transition plan? And all of these other pieces that are just sort of the mechanics of it before you actually get into the actual application. And, you know, yeah, we had a letter from myself, and we had a grievance procedure that we've since, you know, added to. But what I'm getting at is, even though we were fortunate to get the grant and that pickleball court, although I haven't ever played it yet, I understand, you know, it's accessible, it's well used, but it sort of just put the nail in the coffin that we needed to deal with this, right? And so we knew that we needed an updated plan, because the one that we did have that worked for us in the submission was, I don't know, maybe 5 or 10 pages, Deb, maybe 20 pages, and just sort of was sort of a very surface-sidal, you know, different things need to be addressed. It didn't touch upon all of our facilities and our schools and our playgrounds and all the areas that needed to be, you know, reviewed. So we realized the next year coming on, when MOD came out with the grant process again, we applied for a planning grant. And that was a tough decision. I mean, we knew we wanted it, but we also knew that there'd be some work to do once we did it, right? I mean, I knew we would have buy-in from the mayor, as Valerie mentioned earlier, and Deb mentioned. I mean, we knew we had buy-in from the mayor and the top administration, but this is, it's like an audit, right? It's like turning over your finances. I mean, we knew that if we got the grant, we were going to, put together a plan. And, I mean, we're very grateful to IHCD and the staff who, have just been phenomenal since day one as well, once we were awarded the grant. But we also knew that this was going to be taking a hard look at everything. And, Salem is a very busy city and our population increases with tourism. I will also tell you, because our mayor was so hands-on, which, was just an amazing quality of hers. And I think if you just see her now on her social media posts as lieutenant governor, she's just as interactive as she was. We have a very active citizenry. So, we knew that the public would be looking at this, right? This wasn't just going to be an internal document that would sit on the shelf. As someone I think mentioned earlier, it's a living document, right? So we knew once we got it back, and we did, once IHCD put it together, it's over 400 pages? It's on our website. So it really, makes our other one look really kind of pathetic. But this was the toolbox, right? And this was our list of what we needed to do. And it was a little difficult and a little daunting, like, oh my God, where do we begin? But it gave us a framework and sort of, as Deb said, the lists of things that we would need to do. And like I said, it was a hard look in the mirror, but you have to start somewhere. You have to start somewhere. And that's sort of what got us to, now we have this relationship with IHCD. And, I still call Valerie when I'm in a pickle, no pun intended with the pickleball court. We still reach out to IHCD, very supportive when we rolled it out to the community. I'm probably sort of jumping ahead on all of this, but it is a process and we did have our pain points. And I guess what I will say is it's okay to find out what you're not doing or what you may not be doing correctly. Because what we looked at was we initiated it, right? Like we asked for this. This isn't like someone plopped it on our porch and said, oh God, look at everything you haven't done. This was, we asked for this. This wasn't a gotcha. This was, okay, we know there's a problem. Let's see how big it is and where we can start to chip away at it. Deb, I think I'm going to turn it back over to you.
Okay, so I'll start here by saying that there were changes that I saw take place immediately following the presentation of the transition plan. The very first one was that the level of education experienced by the municipal employees and the residents as well just skyrocketed. Basically, ADA compliance and accessibility issues showed up on everybody's radar. And some very positive steps were taken by city government. Every department in the city now has a line item in their budget specifically for accessibility improvements. And it's part of the evaluation of any plans to make changes, to upgrade, it's just, I really just can't emphasize enough how much in the foreground it is of everybody's thinking. That also means that I and other members of the Commission on Disabilities are receive invitations on a routine basis to participate in work groups and evaluations, and we're famous now, but for good and bad. we're now people are looking to us to understand that they are doing what they need to do to make their facilities accessible and their programs accessible. The Commission on Disabilities itself works very hard to have a representative. Every one of our commissioners is invited to join so that we have a diversity of needs. When we do a site visit, We have someone who is living with blindness. We have somebody who is living with hearing loss. We have somebody who uses a wheelchair. We've worked really hard to diversify at that level so that our commission can give a balanced evaluation when asked. The second point that is so important is that not everything comes down to money, but money speaks really loudly. And the fact that the city was inclined to make the right changes to dismantle the barriers to access was all well and good. But the biggest challenge in it is how do you afford these changes? And so learning that the MOD grant money is available every year and will be for 10 years was, it just really fueled the enthusiasm of everyone involved to go forward with this. And the Commission on Disabilities learned from our mentors. And Lisa, you know the name of the bill of the fines, the accessible parking fines.
Yes.
What are the numbers for?
It was a section of Mass General laws that our city council actually adopted so that the handicap parking violation fines are funneled to the Commission on Disabilities. And the law is clear that allowed the city council to do that, that the money needs to be spent or used to benefit persons, all persons with disabilities. Sorry, Deb.
And that's not, I needed that. And so that has further empowered us to really make things happen. We have been approached by the Little League, sports programs, the food bank, the Salem Food Bank, and several other organizations, because they know that we can assist. And so while we are not able to fully fund some of the changes in their programs or facilities, we can at least help. And it just is such a powerful change. We're not just tossing these rules out there and saying, you're on your own. You know, we're there to help and to guide, and also we have some money, and that's very, very helpful. Every aspect of our city has been touched by this. We've put accessible picnic benches in our parks. We've installed accessible playground equipment all over the city. We have a new facility down at Forest River, which is a very beautiful pool and surrounding areas. And the project started with how do we make this accessible? So the pool has a lift to help people into the pool, but it also has ramps into the pool, and all the grounds around it are wheelchair accessible. We stay in close touch with the Community Life Center with regard to their needs for accessibility. We've been able to make assistive listening devices available for public meetings, and we have a designated fund when we have the need for interpreters. I mean, it's been very exciting to see the changes. We're not done, and we continually receive complaints and expressions of need for more, to undo more barriers, but we're working on it. I want to make sure I said all of our polling places were
Yes.
weighted for accessibility. Did I leave? Can you think of anything else that needs to do in there, Lisa?
No, actually, you did a great summary of all of that. One thing I wanted to mention is, and I think we're just gonna make our time limit. I think that we've learned throughout this whole process is it's awareness. And once you're aware of something, it's kind of like saying, you didn't hear the school bell, or, you can't unring that bell, you can't unring that bright light, right? Once you know it, once you're aware of it, it just sort of heightens everything that you're doing. And so to Deb's point, all of our department heads who were present at our initial kickoff when we introduced the IHCD team, and to let people know that, there'd be people in measuring and looking around their departments and going to our different buildings and our facilities. Once there's an awareness, now we talk about it, right? I mean, it's not unusual for me to get a call from the Department of Public Services. Hey, we're doing, this curb cut over here. I want to notify everyone on the commission, or could you check this out? Or we need to redo something over here. What do you think about accessibility over here? Would it be okay if we move this over there? I mean, I'm speaking in general terms, but these are the conversations that we're having that I can tell you we didn't used to have. And so just the fact that it's brought up and it's at the table is huge for us. I think the transition plan really kicked up our credibility a notch. I think that we get variance requests, right? So variance requests when developers kind of want to do things a little differently, that will need to go to the Architectural Access Board here, in the state of Massachusetts. The local commission on disabilities is copied on that request for a variance. And we were told at one point, I think we thought, Deb, that, well, they don't really care what we have to say. That was several years ago. And then Jeff Dugan, who is part of the MOD team, who has come to our meetings in the past, told us, clearly your input is valuable. And so that sort of gave us another, like, all right, we've got a little more credibility even at the AAB. And we recently had someone come in for a variance request, again, because we work collaboratively with our planning department and our historical commission and our conservation commission and all the other different groups. And they actually listened to what we had to say, because we weren't really happy with part of the variance request that they were putting through. And we gave our feedback, which wasn't as positive, I think, right, Deborah, as they would have liked. They went back to the drawing board, literally, and asked to visit with us again. And I can tell you that what they decided to do over at our Old Town Hall is still beautiful, preserves a historic integrity, and still doesn't sort of relegate accessibility to the backyard where nobody wants to see that accessible entrance. It's front and center pretty much, and we really felt heard. So I think it really goes back to awareness and your credibility, and be ready for realizing that maybe if you do your transition plan, once you get your area, you're gonna the thought out there is going to be that you've done the whole city. Well, we didn't. We'd like to say that we did. We did. Part of the scope was the our buildings and our facilities and our schools and our playgrounds. But there's always more, because your city isn't confined to just the scope of the work for your transition plan, but it certainly gives you a good base for it. And like Deb said, there's more work to be done. As we mentioned before too, as well, it's not a document that you just get and it sits on the shelf and you say, okay, we check that box now, the transition plan is done. Like I said before, numbers don't lie, the plan doesn't lie. It's there, and it's there to assist. And be ready for some criticism. I would be remiss if I didn't mention that. I would say be ready for a little criticism, like, why didn't you do this? Or now that you have that, why didn't you do it before? Okay, we get that. But again, we initiated it. When you go on this road, you've initiated it. So that's already half the battle. It's doable, and you just need to have, I would suggest you surround yourself with resources and reach out to, those of us here today. I mean, I think there's some more questions. We really are all in this together. And I think that Deb would agree with me. And like I said, we've reached out to Valerie, we reached out to Anna, we reached out to David, because we had some serious pushback on some different things, but just reach out. People are willing to help.
Thank you so much, Lisa and Deborah. The one thing to just add on a little bit to what Lisa was saying, you do have indeed a very engaged citizenry in Salem. And one of the things that I think is important that people understand, this is what's required. You can go beyond it, and we recommend you go beyond it, but it isn't a mandate of the city to do whatever somebody imagines is a requirement of the ADA. And that proved to be rather a useful tool, that you actually had absolute clarity about what was non-negotiable and that other things were beyond that. And that for your community was a pretty important asset. So thanks very much. We really appreciate it. And I understand that Lisa won't be able to join us at noon, but Deb, I trust that you will.
I will be here.
All right, we definitely want Salem to be there. Lisa, many, many thanks. And we are on to Melrose for our next presenters. And that will be two people also, and in this case, both of them from the Disability Commission in the town of Melrose. So I'm very pleased to introduce David Hoff, who is chair of the Disability Commission, and Garen Boyd, also of the Disability Commission, I believe, vice chair. Gentlemen, are you ready to step onto the stage here?
I believe I am. Garen, are
You are?
good?
All right. Is Garen?
I don't see him on here.
Well, PJ will elevate.
Garen is joining as a panelist right now. So he'll be
Okay,
on.
great. Wonderful. Okay, we'll give it a second.
Thank you.
Okay.
David, take
There he
it.
is. There he is. He has just joined in. So great.
All right. Wonderful.
So thank you. All right. I have slides, so I'm going to put my screen up there. There's Garen. Okay.
Hi.
And you'll
Okay, so
describe the slides.
I've been a part of this since the start. I just got a notification letting me know that I could join as a presenter.
So there we go.
Okay.
Great.
Thank you.
All right. So let me bring my slides up. Our slides up, and let me just one other thing here. Slideshow. Okay. I hope that people can see the slides okay. If you please let me know if you cannot. So thank you. First off, thank you for the opportunity to present on this journey that we've been on at the City of Melrose Commission on Disability and the City of Melrose in general. As Valerie said, I'm David Hoff. I am chair of the City of Melrose Commission on Disability. I'll let Garen introduce himself.
Hi, I'm Garen Boyd. I'm the vice chair on the Commission on Disability in Melrose.
And so we are presenting on the development of our ADA self-evaluation and transition plan. On the screen, we have our logo, Melrose Commission on Disability. It says accessibility, inclusion, community acceptance. We also have a picture of one of the signs at the entrance to our city called, says, "Welcome to Melrose," established, incorporated in 1900. I've been around a little longer than 1900. Our email is commissionondisability@cityofmelrose.org. So feel free to reach out to us after this presentation, and we will also put that in the chat afterwards. So next, there we go. There you go, Garen.
I'm going to provide a brief overview of the City of Melrose. Melrose is a suburban community located about 7 miles north of Boston. We're a population of 29,000 people. We are a city. 4.5% of around 4.5% of our citizens identify as having a disability. To Deborah's point from the last session, I think this is a very soft number. I think there are definitely more people with disabilities in the city. We're 82% white, which we're about 2% African American and 4% Asian American. The average age of, so we were settled in 1629. We were incorporated in 1850, and we became a city in 1900, right in the heart of the Victorian era. So we're very well known for our Victorian buildings and our Victorian fare. That being said, we also have quite an aged infrastructure. The average age of population is 41%. Per capita income is 58,000, and we are a city form of government with the mayor acting as an administrator. And we have 26 active city commissions and organizations within.
Thank you, Garen. And I would say, we are kind of, to summarize, I think we are a very, fairly affluent community. We're somewhat diverse, but not nearly as diverse as, frankly, we'd like to be, given how close we are to the city. A lot of the same issues that have been discussed already about infrastructure and all that. A very active community, and I think the culture of the community, the 26 official citizen commissions and boards says something about our city how it is a city where citizens are very engaged and like to express their opinions. So,
Yes.
so here's our story as a commission. Again, our logo is here on this slide as well. We actually began operating in the fall of 2020, so we are operationalized less than 3 years old. Garrett and I are two of the original members of the commission. We've been on since the beginning. It was really kind of got started spring, summer 2020, but we had our first official meeting in October 2020. Our commission has 7 members, the majority of whom must identify as having a disability. One can be a family member, so one of those disability members can be a family member rather than identifying themselves. The members are appointed by our mayor and then approved by the city council. And the requirements for disability commissions, I don't know if this was mentioned earlier, again, to come on a little late, in Massachusetts are written into state law and supported by the Massachusetts Office on Disability. And so, for example, our bylaws are based on the sample bylaws that came from MOD. And there's actually requirements that are in state law. And I think that's one of our strengths as a commonwealth or state, that we have this written into state law. Not that every municipality has a disability commission, it's still optional, but the fact that we've got a structure and support from the state and support from MOD, I think is really great to see.
And I'll speak to, sort of what the things that worked for us, the keys to success, and basically the landscape that existed, prior to us going after the grant and doing the self-assessment. One of the huge pieces, and I think this has been brought up multiple times, is mayoral buy-in is huge, and having senior administration recognize the importance of accessibility, recognize the importance of making buildings and public spaces accessible as possible is huge. Our mayor has run on a very large DEI platform. The Commission for Disability, I don't think started the idea for it started with him, but he definitely threaded the needle and got the commission together, as David said, in a fairly quick manner. Over the course of the time that we worked on getting the grant, we had buy-in from a lot of the city officials. A lot of the meetings that we attended, planning for having IHCD come in was done in accordance and with support from administrators within the city, which was huge. And then also, last but not least, having the support of a great commission. Again, we're really new as a commission. We just started in 2020. We have had a little bit of change since that point, but having good, strong leadership and having people who understand, like David, policy with disabilities, but also have the personal knowledge, like myself, of being a person with disabilities and knowing what is required is huge. Our city motto, and I should have mentioned this when discussing the city, is one community open to all. So that's a really huge motto to fill. But I think our mayor, our commission, and members of the staff, for the mayor's staff, have been really instrumental for getting us the support we needed to push this through.
Yeah, I know some people have talked about this a little bit. I think what was key, we never at least saw, for lack of a better term, the kind of collective eye roll when we bring things up or meet with the city departments. It was always very positive, very much, yes, this is great, we're doing this is great, we're moving forward on this. Yes, we see this as important. And that was really been great to see. So in terms of the ADA self-evaluation transition plan, kind of where this idea came from, on the screen here you have the Americans with Disabilities Act logo, which just to illustrate where this comes from. Certainly identifying the need. As we began as a commission, we realized, okay, where do you begin as a commission? And what do we start to work on? But we knew that there was a real need to just start to analyze the city in general in terms of accessibility and to make city events, activities, community events more accessible, more welcoming to people with disabilities. We used the Mass Office on Disability to help support us in our initial start, and Jeff Dugan actually was very kind to come and present to us and talk about MOD. And so we quickly became aware of the grant opportunities, but also just started to dive in quickly on, so, okay, what are the city obligations in terms of self-evaluation plans and accessibility? And I want to give kudos to the Institute for Human-Centered Design and their website, which has great information about transition plans and about self-evaluations, just really, really clear in terms of just the information and what's required, et cetera, et cetera. So why it's important, I hope this is self-obvious to this group, but obvious, it's important. For one thing, it's required by the law. It's required by the ADA. The last time our plan was done was 1996. So this was an update of a 1996 plan. I think one of the weaknesses of the ADA is that there's no requirement for it to be updated. So you did the plan when the ADA was passed back in the early 90s, done, put it in a file somewhere, that's it. And I think that's just to reinforce some of the points that were made already. Number one, you need somebody advocating or some group pushing and saying, look, what's happened with our plan? Do we have a plan? If we don't have one, we need to have one. Should have had one long ago. And even if your plan was developed years and years ago, clearly it needs to be updated. I would love to see language in the ADA regulations that says this plan needs to be updated, every decade or so at least. I mean, I think every 10 years at a bare minimum. But it really is really important to have this blueprint. And as Garen mentioned, I think, we have a city that is committed to diversity, committed to DEI, DIA. Actually, I like calling it DIA, actually, disability, equity, inclusion, accessibility. And I work on a project that in my day job that uses that acronym, and actually I really like that. But we are connected with the overall efforts in Melrose to, be inclusive of folks with diversity. And part of, I think, really pushing this self-evaluation transition plan is to make that connection and to say, look, part of being, everybody's very hot on DEI right now. So part of that includes people with disabilities. They need to be part of the conversation, and creating and developing or updating a self-evaluation transition plan is very much aligned with that.
So the next section is plan development and how we basically got the grant and what we did with it once we got it. So I believe it was in December, David, when we first applied for the grant.
We applied in September, actually.
September, okay.
Yeah.
So at that time,
and received it in December. We got the notice of receipt in December. Yeah. So yeah.
Okay. So they received our request for the grant. The grant was put together by David and by our former Vice Chair Paula Wiener, who is no longer with the commission. And I think, to be honest, we honestly didn't think we were going to get it. We're a new commission. It was our first time out, and we were very pleasantly surprised when we did receive the grant from MOD. It was a great boon for morale in our commission. So instantly we put a request in to try to get contracts in to have the assessment done. I remember at the time it seemed like we were really running to the door to try to get this all in place so that we could spend the money that we had gotten from MOD in a timely fashion and get moving on this plan. So that we were awarded, and then we sat down with the city, came up with the scope of what we would be doing: city buildings, public space, schools, which should be in a huge, it should have a giant S on there, because that is was a huge undertaking by IHCD going into this. And policies, communication, staff, and education within that staff was also added to the focus of this. And then IHCD met with all the department heads, discussed areas that they thought needed assessment, and move forward with that. And last summer, all the site visits were conducted. A draft report was created soon after that, and the report was delivered to the commission soon after that, around December of this year, and then we had requests for comment by our citizens right afterwards. So in all, the whole process, pretty much from start to finish, was about 9 months from when we received the grant to having all the work done, having the assessment done, and getting the report back to us, and having it brought out for request to comment to the city of Melrose.
And so this is David, and just to add to that, thank you, Karen. You're probably wondering how much did this cost? Ours, it was about $50,000. So 50,000. That and we put a link to the plan documents in the in the chat there. So, and we worked, I mean, the city itself, we are a city commission, but the city itself had to take care of all the contracting and things like that. But we worked very closely with them in terms of soliciting bids and moving forward on this process. So, and again, we got again, great cooperation, great partnership, no resistance whatsoever, just kind of made it happen. And that was really, really helpful in terms of moving this forward and ultimately completing it. So. I also just want to mention in the schools were a big piece of this, but the recreation areas were a big piece of this as well. And I think it's really important to, when you look at these kind of things, looking at external, and people always think about, oh, parks. What about parks? Yes, of course, parks, recreation areas. We have tennis courts, things like that. So those very much should be part of it. Also, looking at our policies. So that was part of the evaluation, was looking at our current policies in terms of are they, in terms of the city's policies about accessibility, accommodation, modifications, et cetera, et cetera. One thing I also, before I move on to the next slide, I just mention this. I've looked at a number of different plans done by different entities. I cannot stress enough the importance of having experts do your self-evaluation transition plan. And this is not just this is kudos to IHCD, but I know there's lots of other great entities out there that also can do these things. But I've also am aware of some plans that I looked at that seem to have been done by the Disability Commission itself, or a city official, or somebody like that. There is a level of expertise required to do these plans well, in terms of understanding all the technical details in terms of accessibility. I mean, I work professionally in the disability world, but I could never do a plan because this is not the area that I have a working knowledge, but don't pretend to be an expert on it. I can bore you all day with things about employment policy and the ADA, but this area is not necessarily something that I pretend to be an expert on. And having also an external entity do the work is also important, because they can be neutral about it as well. So you want expertise, you want people who know what they're doing, you want people who can produce a quality plan, but you also, so all of it, but that external body is also helpful as well. So just bearing that in mind as in thinking about this process. So the format of the report, again, the report is on the public available documents. We gave you the link, so feel free to take a look at those. So it was an executive summary, which had some subsections to it. Also, a comprehensive self-evaluation of the facilities, the buildings, the policies, and then a transition plan with detailed corrective action recommendations and cost. And then what is not part of the public document, but which is incredibly valuable, spreadsheets that we were provided with items categorized by priority with estimated costs. So, I mean, things like, yes, this is an ADA violation, this needs to be addressed immediately, versus, yes, this would enhance accessibility, but is not really a requirement, et cetera, et cetera. So those spreadsheets are really helpful in terms of helping the city determine next steps moving forward, which we'll talk about in a second. The other thing I'll say about the plan, and as you take a look at it, it is extremely well done from our perspective. In our city, we got basically positive comments from virtually anybody who commented on the plan. Highly detailed pictures of each area and areas to be addressed, estimated cost for anything interior. They didn't do estimated cost for exterior, things like parks and things like that. but the level of detail and also the professionalism of the presentation, I think really helped in terms of engaging folks and understanding this and getting into the details of what needed to be done. So, and really it's again, I think a high quality professional plan can be really helpful in that regard versus something that's just 30 pages of text, which is not necessarily very accessible, but also really does not really, is not nearly as helpful as one that just gets into shows visuals and really explains clearly the issues that were identified and how they could potentially be addressed.
So outcomes to date.
Oops. Or next steps. You're on the
Oh,
wrong
I'm
slide.
sorry. Next steps. Thank you. Sorry.
This is you.
This is me. Okay.
Yes.
So the next steps is we're going to have a final report that we're going to present to the city council, and that will be also sent to the school committee as well. The city will begin addressing needs and identifying funding for this. We'll definitely move forward with that process. Again, once we have buy-in from the school committee and from city council, the next step will just kind of fall into place, and the money will begin to be used for transitioning. And then, of course, our commission will continue the path it already has started with continuing to monitor and make sure that the transition process is going along in a timely manner. We're going to address policies and procedures to ensure city meetings and events are fully inclusive and to people with disabilities. Much like what they said in Salem, event planning for this and coming up with policies for every single meeting to include accessibility options is huge, and hopefully we'll be able to get that, start working on that as part of the city and make sure that all of our events and everything going forward is as accessible as possible. Anything else in that regard?
Yeah, I added one other thing. We also need to engage our new ADA coordinator.
Oh, yes.
There's been a lot of discussion. I added this morning to the slide because it's been a lot of discussion about ADA coordinators here. I would say this is a bit of an issue in Melrose, to be honest. We were hoping we had an ADA coordinator who was the building inspector. He left for another position. In talking to the mayor was hoping, Mayor Berta was hoping to identify funding for at least a part-time ADA coordinator that was fully dedicated to ADA and accessibility. The reality of funding was that he was not able to identify the funding. So they've just hired a new building inspector, and that the ADA coordinator is part of that position. The challenge we've got, and we have not met this individual yet, is that it's obviously when it's added on to the building inspector's job, who's doing a lot of other things in the city, it can create some challenges in terms of dedication to the ADA coordinator position, as well as, frankly, expertise. Do they have sufficient expertise? But we're going to work to engage the individual as our new building inspector, have them come to our meetings. We're not at a level that it's not a level that we really like to be in terms of the position, but we have to make it work with what we've got. There is some interesting news in Melrose this week that our Mayor Broder, who's been great and such a champion of ours, has decided not to run for another term. So we will be getting a new mayor as of next year. And again, potential there. We'll continue to advocate for a kind of a stronger ADA coordinator, more dedicated position. The other thing I'll mention just on next steps is we are working just in early stages of somewhat of a mirrored process in terms of community events, not really I'm talking about community groups that are not officially part of the city, but we're in the early stages of working on a toolkit and starting to present to community groups in the city to start really trying to make all community activities open, accessible, and welcoming to people with disabilities. So, less of a formal process of doing a full-scale evaluation, although, we have a working knowledge, but there we really want to just really raise the awareness. And we think this plan is really helping in that regard. Now that we've raised the awareness of disability issues in the city, taking it out beyond the official city buildings and activities and things like that, but more out to our various community groups, clubs, et cetera, et cetera. So to wrap up here, these are outcomes to date. We have now have a really great detailed blueprint for increasing the accessibility of city buildings and services that will guide us over the next several years. We have a really strong reference document that is already being used for other initiatives. Garen, I know you were meeting with a group. There's a public health grant that our city got along with a couple of other local communities on accessibility of healthy activities for people with disabilities. And Garen shared that with that group, and they were very impressed that we'd already gone through the parks and things like that in our city and already looked at them in terms of accessibility. So I think it's serving as a good example of the kind of analysis that can be done, and the fact that it's a reference document that can be used throughout the city for various initiatives. And as I mentioned, touched on already, I think this has just really raised the profile of the commission and disability inclusiveness in the city. I will say that we made an effort and continue to do so, getting in front of our city council, getting in front of our school committee, and talking to them about these things and making sure they're aware of the plan, and as it was being developed, to ensure that they were aware of it, they knew it was coming, and now we're going to start to work with them in terms of addressing the issues that were identified. So that's it from us, I believe. I'll just stop sharing. I see there's some things in the chat here. I don't know if those are questions specific to us, but please email your slides. Okay, yes, we can do that.
It's been just a really very, very positive experience working with IHCD on this. And I believe, as a municipality, we're stronger for it. As David said, being able to point to this very, very detailed, very, very well organized report and say, we can show you what this building needs, or we can show you what this park needs to be accessible, is just great. And knowing that people are not going to have to replicate the same cycles over and over again and do this assessment either through the city or, as David said, in a non-professional way that would not yield the same results. But all in all, the experience has been really positive. And as a citizens commission, to be able to have gotten the work done that we did is a huge point of pride, I think, for myself and most of the commissioners. And just doing this work is so very, very, very important.
Thank you both. I really valuable detail and very clear slides that I think will be valuable to other people. I have one last question. I don't want to skip a minute of your time. Many cities and towns cannot actually manage to combine schools and everything else, and Melrose did. And I'm just wondering if you have any reflections on that. To some extent, it's a budget issue, like it's their budget, it's their problem. Melrose married them. And I'm just curious if you have any last thoughts on whether that was a valuable thing to do and how it worked for you.
Do you want me to start, Garen, or you want to start?
Sure. Yeah, you go ahead.
I think it was incredibly valuable. I'll just say that. I think that, and that really was never really much of a question, because it was just part of our original grant proposal. I mean, frankly, the mayor wanted us to do the cities, the sidewalks and everything too. Just, our scope. He wanted to just keep growing the scope, which was great. We didn't do that. Would have been nice to do that as well, because we have issues there. But it's just, the schools, that's a major part of our municipal budget. A major part, it's like half our facilities. And I would say there was a ton of findings in our schools. That was actually a major portion of the probably the major capital costs that'll be required. And I just see it again. I think other people brought this up before, but we'll say it again. You can't do anything if you're unaware of the issues. Saying that, well, we don't want to take a look at this because we know we're going to find stuff. Well, it's there anyway. Mm-hmm. And to just put your head in the sand and say, we don't have the resources, we don't have the money. I will also say, I did meet with the mayor last week, and he's already said he's got some free cash that he at least wants to start on some low level stuff. And so, and which is great. They've already already trying to move forward on this. And he says, you know what, we're probably going to do some bond issues and some other stuff and try to incorporate this into our regular city capital improvement budget, but that's fine. That's what we're committed to. So I don't know if you have anything to add there, Garen. Yeah. Special education has been such a huge part of our Commission on Disability. I believe that the special education coordinator has met, comes to our commission meetings every time, if not, every single time we have someone there from special ed. So
Schools are a huge priority for us, I believe, just because it is in the scope of this, and we did see, things that could be done better. So yeah, it has been I think it's been really important to marry those institutions.
Thank you, Garen and David, and we'll see you at noon.
Okay,
Thanks
great.
very much.
Thank you.
And now we're going to bring forward our last municipality. And actually, this is Andover, Massachusetts, is distinguished as being the one with the most experience because their ADA transition plan dates to 2017. And I'm very pleased to be able to bring forward Janet Nicosia, who is the Director of Facilities for the city of Andover. And she has been involved from day one and has had this practical emphasis on how do I make it happen, and just keeps picking away at it. She's got a good story to tell, and I'm really looking forward to hearing from her. Janet, can you come forward, please?
I think I am. Can you
There
see
you
me?
are. Thanks so
All
much.
right.
The floor
Hello,
is
everybody.
yours.
It's like feels like I'm among friends. So yes, I'm Janet Nicosia. I'm the Director of Facilities for the town of Andover. I've been at the town of Andover for 19 years. I do serve as the ADA coordinator. A little bit about Andover. Population of Andover is 37,000. I'm rounding these numbers. 13,000 households. 76% of them are owner occupied. The median age is 42. 65% of households have income over $100,000. We're about 22 miles north of Boston. I think that gives you a little picture of the town. Interesting, and I just saw another education attainment statistic. 75% of the residents in Andover have a bachelor's degree or higher. So it's a very educated community, also a very engaged community. And the people of Andover, they really love Andover. They have a lot of pride in the town. And I think that's helpful as we work on the Commission on Disability work. People do want to do the right thing, and they do have the interest in changing the world. So we have a select board with a town manager type of government. And our history with the self-evaluation plan is that there actually was a self-evaluation plan done in 1997 by a man named Jack Berger, who was an engineer at the time. And then we had a 2002 access barriers study done by Northeast Independent Living of the schools and police. And then in 2017, we received a grant from the Mass Office on Disability to perform a self-evaluation and transition plan done by the IHCD, Institute for Human-Centered Design. So my presentation today is to sort of give you the nuts and bolts of how we took that plan and turned it into action. I think I would mirror everything that everyone else said in how they got ready and getting buy-in and all that stuff. It was just really music to my ears, wonderful stuff. But I'm more of a facility person, so I'm kind of an action. I don't know. I'm not a theory, so I get things done. I have a lot of people behind me and that help me and that have helped push all this forward. And I want to just really want to call out Justin Coppola Sr., who is the chair of the Andover Commission on Disabilities. He's been on that on the Andover Commission on Disabilities for 23 years. He received the 2019 Thomas Hopkins Disability Access Award in Massachusetts for being the ADA Advocate of the Year. So without Justin, all this work, a lot of this work might not have taken place. And there are many, many people with Justin that started the Commission on Disabilities in Andover in 1995. So I got to give a plug for Justin and the whole Andover Commission on Disability. So let's get into the nuts and bolts. So I think you guys have I'm going to share my screen and run you through, and I will try to explain it for those of you who have vision issues. So first, I think I'm going to, I think I'll do it as screen. And then, so what you should see on the screen now is what is the ADA transition plan that we received. And here's an example of one building and what the plan looks like that you get from the IHCD. So there's a background on the building, and then you will end up going, and as I'm scrolling through, they talk about how much the total cost is to do the work that needs to get done in that building. And then individually, you will receive a report, picture by picture, of exactly things like item number 1, the walkway having the running slope that is over 1 by 20. Clear width, parking issues, accessible parking not being properly signed, and the surface the sign is obscured. So there's all sorts of things that we're able to look at piece by piece. And over on the right, it shows you where it is, a picture of it, what are the issues with it, what are the recommendations for it, and then a cost estimation. And I will say that we felt that the cost estimations were low. Now in Massachusetts, costs are very high, and probably anything here that was done in 2017, you can about double or more. But so we had our own construction project manager look at the prices that were, I think they were RS means prices, which is a normal costing mechanism that people use. But in the state of Massachusetts, we're required to pay prevailing wage for all work done for the municipality on municipal land. Prevailing wage, if any of you don't understand what prevailing wage is, it is basically roughly the equivalent to what the union wages are in the area. It's a longer definition than that, but that is basically what it means in practically for us. So to explain to folks what we're looking at a spreadsheet that comes from the IHCD, which shows us each individual issue for this particular building that is letting us know what the issues are and how much it would cost to fix them. So I'm going to reduce this, and I'm going to show you that we then took that and took the spreadsheet. Let me explain this a little better. So we received the items in spreadsheet form from the IHCD. And then what we did was we created a master spreadsheet of every single item. There were almost 1,500 of them that were identified by the IHCD that needed to be worked on, so that we could then track how we were going to move forward on getting these things done. The last thing we wanted was a plan that was going to sit on a shelf and say, okay, we did the plan, and then we never did anything with it. So we knew it was a daunting task. We knew it was a lot of money. But if we don't start somewhere, we weren't going to get anything moving. So what I'm showing here is the spreadsheet. Part of this came from IHCD, and then what we added on to it. I'm going to read the columns off for you, for those of you who may not be able to read it on the screen. So we simply put an ID on it, and so here, I'm going to follow you through Cormier Youth Center on line number 110, facility name, Cormier Youth Center. What's the element there that has an issue? The door. And then what's the physical barrier? The door requires more than 5 pounds of force to open. Where is it? It's in the gym. What room is that? What priority is that? This was priority 3. And what is the priority for barrier removal? This is additional access. So if we look at this, the headers for this column, the categories that the items that need to get done are split into does it provide additional access? Is it enhanced usability? Is it a good example? Sometimes it's actually something that's a good thing? Is it a navigational issue? Is it program access? So it has to do with programmatic access. Is it safety? It's an emergency, or if there's something that's blank, it might be just for a notation. But just gives you like a look at what these categories are. And then what is the remedy? So for this particular one, the remedy is to adjust the closers so doors do not require more than 5 pounds of force. And I know this is a simple issue, but you'll follow me with this, and I'll show you how we resolve it. So we have one item. We had an estimate of $300. We thought maybe the door might need to be fixed. It ended up costing us $40.61. We had one of our carpenters assigned a work order to go fix it. He spent 1 hour going over there and fixing it. It was resolved on October 9th, 2020. We changed the status of this one item to complete. And then over here is the school dude work order. We use a work order system. We're very lucky in Andover to have an incredible staff of in-house carpenters, plumbers, electricians, and HVAC mechanics, as well as all the custodians. And so what did the carpenter do? He set the tension of the door to the required tension. There was nothing else that was needed. So originally, when we got this list, we had actually it was a summer intern that we taught them how to use the school dude work order system, which is how all of our work is done by the trade staff. Every trade staff has every hour of their day onto a work order. So those work orders track the cost, their time to the location, and I'm going to show you one in a minute. But this is sort of my example to show you that our intern went and put in all these work orders next to every single one of these. We haven't done all of them, but you can see that what are we on 110. So you can see a lot of them are in all these 3-7 numbers. Some are not in, some are in. So we're to try to march through. And the green represents, if I move over a little bit, I show that I did a yellow release, and that was I couldn't put 1,400 or 1,500 work orders into the work order system. And of course, some of these items are so large that I can't do them in-house. I will have to hire a contractor to do them. So we sent a chunk of work orders out. We call them the yellows. That was the first chunk that was sent out. Second chunk was sent out September 2020. And these are the 2020s that a lot of them are completed. So I'm going to show you one more item well, not one more, but so here's a picture of a work order that would show up on our carpenter's docket for the day. And each carpenter probably has 40 or so work orders in their queue. And so this just shows that the work order was put in at the location, adjust the door closers so they don't require more than 5 pounds of force. We also bought the kits for our carpenters, and that help them to test the running. What am I talking about? The slope, running slope, and also to test the doors for pressure. They adjust doors normally anyway, but we wanted to make sure that they had sort of an ADA kit. So we bought these kits, one for each of the carpenters. There are 4 of them. So we just put in the request, told them what to do. Then when they came back in, Robin Littlejohn, he went and did the work. He wrote in that he set the required tension, closed the work order, and then when this work order gets closed, it goes to one of our staff as our work control persons. And she went in, when she sees a work order that's coded as part of this ADA project, then she goes and looks for the work order in the spreadsheet to complete it and put in the actual cost. So in this way, we're able to march along piece by piece. And I'll show you a little more on here. So if we said, okay, having this filter is just so great, because I see some of them were canceled because we're renovating that building. Well, if we're building a brand new West Elementary school, there were many, many items in West Elementary that were not ADA compliant. But it was a wonderful thing to be able to sweep them right off the list because we have a brand new building that's going to be open in a year. We're not going to spend the money on fixing those ADA issues. As valid, I mean, let me just say, it depends if it's a safety issue. If it's something that somebody needs right now, of course we would fix it. But with budgetary constraints that everyone has to deal with, we do have to prioritize, and that's the sad truth. So if we look at, let's say we look at what's completed, and we can show you that if we scroll up and down this report, all these things have been completed. And that's just for town buildings. Then we go to school buildings. And if we selected here everything that was completed, we would show you all the items that have been completed. It's a lot of items. Okay, so that's several years worth of work. And you can see the yellows, or some of them are yellow and some of them are green. At the bottom of the screen is we took those spreadsheets and we have them separated. So there's parks, which just shows all the stuff that is on the town parks that need to get done. And under facility name, under column C, it shows the names of the parks, what they need, what work they needed done. Indian Ridge at Cuba Street was completely overhauled, so everything there was completed. And then you have school buildings at another tab, town buildings as another tab, utility buildings. I would just say that some of the utility buildings are important and some aren't, because oftentimes people that work in utility buildings have physical fitness requirements. And so unless there's some public access to that building, it's, I'm just going to say often on a lower priority than where we have the town and schools. I just wanted to show you that, there's a way to get this done without, this is a pretty relatively simple process. I think if you look at it, we basically took the IHCD list as a spreadsheet, put in the amounts. We have in-house staff. What about the stuff that is too big for in-house staff to handle? So in those cases, we had to put in, so if you, on the screen, I'm showing that the status of some of these were project for CIP or future renovation. And those are things that may be much larger when you look at them together. Hold on, I'm gonna go up. If I sort the cost from largest to smallest, you might see some higher things, like at the Shawsheen preschool, there's a ramp that doesn't meet the running slope, and that's showing it's going to be $200,000. Luckily, we're actually going to be vacating that school. We don't know what's going on with that school afterwards, but they're going to be vacating that school, so we don't need to do that job. But then there will be items. This is probably in order. Hold on. Let me see if I show the CIP. So there's projects for CIPs, which is CIP stands for capital improvement projects. Some of the projects that were on the major list, we put them in our deferred maintenance list. And I'm going to show you that list. So this list is a lot of the smaller stuff and all of the larger things. And then I'm going to show you our next list, which is the town's deferred maintenance list. We have a outstanding capital improvement list. These are large projects that we're looking to do at the schools. And across the top, the columns are the building type, the building name, the year we identified the need, the project that's needed, estimated cost, proposed funding date. Some of those are blank because we don't have a date yet. And then just for our note to self, sometimes we look to see how many years have been pushed back. And if they're already in our 5-year plan, what year are they in there for? And so if you look at the year identified need, we have a category here for things that were identified in the IHCD self-evaluation plan. And here you look at, there's one here that's identified in the 2012 and 2017 plans and walkthroughs that we had. And if we look at just those, we have site master plan for Andover High School, $10 million. It really is $10 million. So there's a lot of slope issues at Andover High School. Luckily, we're in design right now, and we're hoping to do a major renovation or a reconstruction of the Andover High School. Bancroft School is not a very old school, but it still came up with some issues. There was still some issues in the bathrooms. And this is one of the really disappointing things that we found out is even buildings that were brand new, when we had them reviewed, and Jeff Dugan has, from the Mass Office on Disability, has been a great friend to the town of Andover. And usually Justin Coppola, the chair of the Andover Commission on Disabilities, and Jeff Dugan will come out and walk through any new building. We invite them both. And they walk through a building to identify, how are we doing in this building? How did this renovation come out? Did everything meet ADA as we hoped? And we do find sometimes there are issues with things that were just built. So here's Doherty School. We're doing a large renovation there. And Sanborn School, a few things here. Automatic door openers are needed, bathroom renovations. And we are putting some of these things through our CIP, our capital improvement plan, to get working on over the years. See if that's all I wanted to share. Let's stop share for right now. So, I mean, I'm happy to share any of that information with anybody, but what I wanted to really sort of tell you is that there's a way forward. The town of Andover since 2013 has had a line item in our capital budget for facilities for both town and school. That line item started out as $15,000 a year, one for town, and $15,000 for school. It is now at $130,000 total for the two of them together. That's money that can be spent on town and schools for any ADA issues as they come up. For ADA issues that we want to fix. Sometimes there's smaller issues. We need the parts, we need door openers, we need to work on a small sidewalk outside of a building. So I think that, you know, if there's a message that I want to send to everyone, is that there's a way to get the work done. If you are methodical, if you have somebody at the town or the city that is in charge of capital planning, capital budgeting, and has someone in their ear and in their office and that they go to meetings with, like Justin and the Andover Commission on Disabilities, to which I'm a liaison, continually pushing these what are we going to be doing this year, Janet? What's in the plan? I noticed where are you? How much have you done? Where are we now with the plan? And so right now, the IHCD recommended items for school, town, and parks. And I'm not going to mention the utility buildings because I just don't consider them as important. But there were 1,412 items on those lists. And the IHCD estimated, and we're going to take this estimate with a grain of salt, at $5.2 million. Given the number of things that we have completed using the numbers that IHCD said that they would cost, between the work that's already been completed and projects that are under construction right now, we will have hit 30% satisfaction of the items identified in our self-evaluation transition plan. So we have a large project at the town offices that attacks many of the items at town offices, including stairwells and access for select board meetings, town meetings, public meetings. Access throughout the whole building has been evaluated, and we're attacking everything floor by floor. So right now we're in the middle of, we just signed a contract for a $2 million project at the town offices, which addresses the 3rd floor and stairwells. It will eliminate all the ADA violations or issues that were identified in the self-evaluation and transition plan in those areas, as well as sprinklers. We also will be bidding out for adding an elevator at the Doherty School, and that is an $8 million project between removal of ramps that are non-compliant and adding an elevator. And really, there's more things to it, because once you do a certain amount of work at a building, you then have to make it code compliant. So we're addressing all ADA issues in that entire building within 5 years as a promise to the Mass Architectural Access Board in our application for a variance to let some things wait and let a few things be forgiven, like some things in the historic auditorium. So sort of this is nuts and bolts. So I guess we have the plan, we took the plan, we put it in a framework where it can be used piece by piece. What we're also doing in progressing towards our goal is saying, okay, how do we build it right in the first place? And how do we build it right in the first place is I'm on every building committee that where facilities is always has, the facilities director is always on the building committee. I make sure that I'm looking out for ADA issues in any construction projects that we're doing. My whole staff, about almost all of my staff that is involved in the planning has gone to the community access monitor training that the state of Massachusetts offered, so that they can understand, recognize, and work to fix any ADA violations. And when we designed the West Elementary Shawshene Preschool, $168 million school that is now under construction, we hired the IHCD to do a peer review of the design, so that even though the architects are quite experienced, things are missed, and things were missed. And not only were things missed, but the design got better by this review. The peer review, I think it was $3,000 with a cost of $168 million. That is a drop in the bucket to have somebody go through hundreds of pages of plans and identify things on how we could make that job better. Some other things we have done in Andover that have resulted from really this relationship, and I would say everyone from the town manager to the citizenry to all the department heads has truly embraced what's going on with the addressing the Americans with Disabilities Act in Andover. There's tremendous respect for the Andover Commission on Disability throughout town. They are asked for their advice. They're asked to support and speak about warrant articles at town meeting. And we're adding assisted listening. We have assisted listening now and closed captioning on our cable TV program and at our town meeting. And it's being added room by room. Assisted listening is being added to all gathering spaces. So I guess I know I'm running out of time. So I think I want to say a little bit of lessons learned, because not everything is perfect, right? So challenges are historic areas, historic buildings, they are a challenge. Recreation has been a challenge. Understanding that, getting people to understand how the ADA relates to recreational areas where folks that operated in those areas may not have the realization or the education about how the Americans with Disabilities Act needs to be honored in recreational spaces. And then our lessons learned are really just that people have to get on board. You follow the rules. It's not that tough. Yes, it is money, but like everyone said here, be humble and don't worry about the fact that everything isn't perfect. Have patience and have a methodical plan so that you can have some success in moving forward, and build it right in the first place. Review the plans through an ADA lens, so that as things that we get excited about that we're building and providing for our citizens in towns, that from the get-go, they're already ADA compliant. Thank you so much.
Janet, you delivered as promised on, she knows the nuts and bolts and she's made it happen. We are ready for the panel to be elevated, and we've had some interesting, important conversations on the chat. For the panel discussion at noon, we actually request that you go ideally through Q&A. The chat has been invaluable for being able to communicate with each other during the event, but just to simplify things, so I'm not trying to pull from both sources, please try to put your questions into Q&A. And we have had a number of people comment on the fact that we did not describe ourselves in the beginning of the day or when each presenter began to speak, and we will correct that for the panel discussion. So apologies for that. Appreciate being called on the carpet for that. We deserve it. So we are now going to elevate all of the panelists who are still with us, and I believe the only one that we've lost is Lisa Camarada from Salem, and Salem represented by Deb. So if we could elevate all of the panelists at this point, do we have everybody with us, PJ?
It looks like it.
Okay.
This is David. I cannot turn on my video.
Okay.
It says you can't start your video because the host has stopped it. Okay, there we go. Now you can see me.
And now you're live. Now, so you're going to have to describe yourself. So
Okay.
I guess I should begin in that effort to share what are other people looking at for those who are blind or very low vision who are participating in the event today. So this is Valerie Fletcher. I am an old woman with big glasses and a short dark red bob. Janet, you want to begin? I can see you next, so describe yourself.
Okay, I'm a 61-year-old Greek lady and with dark hair and glasses.
Thank you. Deb.
I'm an old lady as well, with red glasses, brown and gray hair, in a turquoise shirt, and I'm short.
Garen.
Definitely understand the importance of this. I am visually impaired as well, so it's really important that we do describe ourselves. I am a middle-aged white guy, balding with a goatee.
And a mustache.
Yeah.
David Huff.
I am a middle-aged, getting into older age, white male, wearing glasses, short, thinning brown hair, wearing a maroon shirt.
Thank you. And next up, Lisa.
Hi, so I will be here till about 12:30, Valerie. I
Oh,
just wanted
great. Terrific.
to be part of this, so I'm glad I was able to. I just need to be over at our fire department for a little close to 1 o'clock.
Okay.
Anyway, I am a 60-year-old woman. Glasses. I was going to say I was 19 because that was a good year, but glasses. I don't know. My hair is a little light today. Next week it might be a little darker, but and I have on a black sweater.
All right. Very good. Tammy Cunningham.
Hello. I am a middle-aged white female. I have glasses on that have black rims, and I have medium length brown medium brown hair.
Thank you, Tammy. Paul Logan.
I am a 62-year-old male with extremely thinning gray hair.
Hmm.
A light blue shirt.
Michelle Tyler.
I am a middle-aged woman with light tan skin. I have shoulder length curly hair that is brown and kind of a honey brown. Today I have on a light blue dress with big chunky silver jewelry.
Thank you. Bob Gears. And
Yes.
actually introduce yourself, Bob.
Okay, thank you. Yeah, my name is Bob Gears, and I am a middle-aged gentleman, a cute red-headed guy, Irish Catholic from Boston. I have a reddish shirt on, and it's really good to be here, and I appreciate all of this. And anyway, I guess that's about it.
All right, let's see who we have a whole lot of folks. Let me think who is not introduced in the panel. We want to at least make sure we've done that, or we'll be here all afternoon. Let me see. I think we've introduced all of the panelists. And I think we now are eager to get questions, and I am going to start with fielding those questions. I'm going to start with Bob. So has the IHCD heard of universal accessibility? Bob, we are pioneers in the universal design movement back in the 90s. We changed our name on our 30th anniversary. We're a 45-year-old nonprofit. We now prefer to use the term inclusive design as more meaningful in our time. We started that process 7 or 8 years ago, and it's working appropriately for us. It means something to a lot of people that universal design did not. Universal design sounded like the Holy Grail, and it is not a Holy Grail. As everybody's talked about their work today, they talk about it being a continuous process. We will never reach the end of this process. So we don't choose to use the term universal accessibility. We want to be very clear that accessibility is a non-negotiable floor upon which inclusive design stands. So I hope that answers your question.
Everything is very progressive and all too. And I started with this stuff back in the 70s when I worked in the public works for Boston. We were the first city to design the handicap ramps, which became pedestrian ramps. And, so I've been involved with a lot of this pre-ADA and post-ADA, and I'm grateful to see all of this that's going on. And I'm grateful to be part of this now too, and part of the your organization too, Valerie. Thank you.
Very nice to see you, Bob, and appreciate that. David Hoff, one of our presenters, has actually said, my understanding, having looked into the issue, is that beyond the requirement to have an ADA coordinator, there are no qualifications or hour requirements. In Melrose, it is part of the building inspector's position. And David mentioned that earlier. And I think this is worthy of reflection and comment by the panelists. And if other people in the audience would like to step up, this is an area of consistent frustration. So please, panelists, who would like to grab that one?
I will jump in.
Just identify yourself when you answer. So
thank you. Sorry, Michelle Tyler in Randolph. I did indicate that we do not yet have an ADA coordinator in Randolph, but when I initiated the conversation about self-evaluation plan, specifically in the building department, the comment was, well, I'm the ADA coordinator. And as I became educated, I said, well, there's more to it than making sure that counters are at specific heights and that there are ADA parking spaces in parking lots. There's far more to it. So it is something that we run into, that there's a thought that accessibility is literally just physical accessibility. And do you have ramps and counters and parking places? And I've learned that it's so much more, and that while a building commissioner may be an applicable ADA coordinator, probably not fully, because they're also not in the building full time to handle things like when someone needs accommodations or has concerns or complaints. That's been my experience in Randolph.
I'm going to turn to two people who are ADA coordinators in their towns, and they started out in another area that gets an assumption that is prevalent, that it's really about what we call Title I, or the employment provisions of the ADA. And those two people on our panelists are Lisa Camerata from Salem and Tracy Cunningham of Barnstable. Both of them live their work lives for their municipalities in HR. Could each of you speak to this issue?
Sure, I can go first, Valerie. This is Tammy Cunningham. So we were having a very thoughtful conversation in our community when we started to begin our journey of the ADA self-evaluation and transition plan. And for many years, the ADA coordinator, it was the HR director. But through a very meaningful, thoughtful dialogue as we were going through our plan process, it was identified that perhaps a complementary role for me, because of the work that I was already doing in human resources, because I am the assistant human resources director, in that I handle a lot of reasonable accommodation requests through employees, as well as those who might need accommodations as they're going through the applicant process. I'm the liaison to the Disability Commission, so I'm immersed in the work of our inclusive design and accessibility. And through that conversation, it was identified that perhaps because of the work that I was already entrenched in, it was a natural fit for me to assume the role of the ADA coordinator. And I think it's super important that when a community does identify that they need an ADA coordinator and what that ADA coordinator kind of will look like to the organization, it should be a person who is very much engaged in conversation, in that you are the champion for accessibility. You are impacting the culture, you're bringing about change, you're immersed in all of those items of the policies and procedures, all of the facility modifications that need to take place. This person is at the table and they're able to kind of answer those questions in a very informative manner and impact the culture of the town to identify that this is an area of importance and this is what we're going to do, from a very thoughtful, engaged dialogue amongst our organization as well as the community.
This is such an important issue. I'm just going to ask other panelists if anybody would like to also step up on this issue of the non-requirement of the specifics of an ADA coordinator.
Can I jump in, Valerie?
Please do.
And I do this because it used to be the HR director, and after we did our self-evaluation and transition plan, and the HR director saw all this stuff that was physical that really needed addressing by facilities, then she said it makes sense for it to transition to me. But I will say we sort of retained some things. So I have a budget. I have a capital budget. I plan for construction. A lot of the ADA, a lot of the things that are needed in order to meet the ADA are physical barrier removal, are physical things and involve construction. But there are some things that don't. And so when somebody would, let's say somebody would call up and they would call me as the ADA coordinator and they would say, I have somebody in my office who they have a disease and so they're very cold and they need heaters. And so I make no opinion on that because I don't feel like I should know their personal case as far as their medical. I'm not going to get involved in their medical. So there's a lot of medical things that happen. So that we agreed that HR would handle that. If there's a reasonable accommodation that they would like done for a person for medical reasons, they just let me know what a person needs, and I don't question it. Because, I mean, unless it was something major, but that would cost $50,000. And usually it's not. Usually it's a heater, or they need better light or dim light or something like that. So we sort of split it up. But I feel like if you have it sitting in a department that is not involved in construction, how are you going to get the construction done? Because a lot of that list is construction related.
Thanks, Janet. Any other points of view? Because this is such an important issue. And I think one of the concerns that we hear expressed absolutely everywhere is that many people have an ADA coordinator identity that is largely meaningless, that they may even be largely aware of it.
Yeah, this is David Hoff from Melrose. I would just add that it would be great to see states and frankly the federal government to put some teeth into that. I mean, I know it's easier said than done, but to put some clear requirements on it, it would just really, really be helpful. Because in our case, we certainly need that. So
thank you. And I think one of the things, just to share a perspective from our organization, we are very concerned that ADA coordinators are assumed to also have responsibilities for effective communication. That is a very significant responsibility for a municipality. And it is difficult to have the expertise and to be available as needed for effective communication for the public when it is not an employee, but it is the public. And to be able to know what is effective in terms of communication for people, particularly with sensory limitations. And that it's an overarching responsibility, and it is too seldom something that people can easily juggle who are adding ADA coordinator to jobs that are already full-time. So just a point there, we often recommend that there be someone specifically identified responsible for effective communication who is the point person to whom one can bring a need or a question or a request. On to the next question.
Comment on one thing. Can I just
please
on one thing, just to sort of support what Tammy said, as the HR director, for me, it was sort of just part of the job when I came on board, right? I didn't really understand a whole lot of it, but as time has gone on, and I would say within probably the last 7 or 8 years, I mean, it's really been ramped up. I think it just kind of makes sense, right? There are times I'm like, oh God, I have to deal with that. But then I like like having to be the person to deal with that, whatever, there's an ADA question from another department, because I already work with these department heads. And so they know me, and they know that I'm involved with the commission, and they know that I've got like an extra layer of information they may not have, or a way to go get it, that kind of thing. And it just adds, it's almost an objective perspective for me, because I can say, listen, this is ADA, as the ADA coordinator, this isn't even an HR issue anymore, but the two merge together, and sometimes they're diverse, but when they come together, it really just sort of, it sort of fits. So like I said, there are times when I was like, oh, one more thing to worry about, but you know what? I think it's actually more effective.
Thank you, Lisa, for sharing that. Actually, I'm going to put Deb Lobsitz on the spot here, because she spent her career in the Mass Commission for the Deaf and Hard of Hearing, and effective communication is second nature to her. Deb, do you have a thought on this?
On having the HR person?
No, just on the role of effective communication for the ADA coordinator, because it is such an important part of the job.
With regard to communication access, one of the things about having the HR person as the ADA coordinator is that they, as Lisa was saying, they really do touch every department of city government, and as a result, the nuts and bolts of providing communication access live with that person.
Yeah.
So the HR director becomes the sort of on-site person responsible for identifying that communication needs. There are communication needs, and we have the following solutions. And at least in our situation, I've made it very clear to Lisa what has to happen. What the lead time is needed for requesting interpreters, what the lead time is for CART providers. When do we show up with the assistive listening devices? Am I answering?
Yes, no, you're totally answering the question. I think, the reliable expertise has to live somewhere. So it's just really important, because it's something that comes up in every single ADA transition plan. I'm just asking our ADA staff to turn their cameras on. So that will be Oshie Harrison and Jason Angel and Stacy Hart. And I don't know if we have anybody else on today. and we will introduce the staff also. But I'm going to actually move on to questions because we've got a lot of them. This is something that I think we do need to speak to. Bob actually asked about years ago, working for the city of Boston, notified that at any point in time they could get visited by the Department of Justice. I think we know that the Department of Justice has overall responsibility for the ADA and certainly for Title II municipalities. And if we didn't, Bob is saying here, if we didn't have our plans in place, that the DOJ would do it for us. That is not quite the case. They do it for you if you are going to be getting a settlement agreement with the Department of Justice, which is not an outcome that most anybody would choose. If that is the case, that can occur, or if there are, the DOJ can come in and also do an audit. That is something that some people may have experienced. That is a very that's a very serious situation, and it can be a nice advantage, I suppose, in that you have something of a terrific ADA transition plan that is delivered by the Department of Justice with very rigorous requirements for completion. They don't just do that; they pick and choose based on where they want examples of places that have a pattern of bad behavior. That is normally what occurs in that case. So no, they don't come in and do it for you. So the feds don't actually pay for this to be done. Prioritize. The next question is moving. Does that answer?
Well,
your
if I could just quickly, that was a number of years ago. I may have misunderstood totally, but what we were being told at the time was that, you know, you need to get this put together, and then that if someone comes in here and you don't have it, that, you know, they're going to put you under that microscope and all too. Yeah, and the other thing that I wanted
DOJ lawyers coming into town.
Yeah, well,
yeah.
the other thing I wanted to say is since MOD more or less oversees the the disability commissions and all too, and that the ADA coordinator for the city of town, do they have a list of requirements or a list of, you know, that's it? Because in the town that I'm with, and that I'm in North Attleboro, they've always appointed anybody. We had the town manager's secretary as the ADA coordinator, and she wasn't qualified, and there was no. And are there trainings so that people can be trained and know what their responsibilities are?
MOD does a terrific job with training.
Yes.
And
yes.
I think just calling MOD and asking for their support is a very practical, simple way to go if you're lucky enough to be in Massachusetts. If you're in the New England states, you can also call the New England ADA Center, which provides an extensive menu of training, and they will do this also. So those are the simple answers to that one. Okay, I want to move on to make sure we get to as many of these as possible. I'd be very interested to know how you prioritize for spending. And this is the prioritization overall in the ADA transition plan, or at least that's what I'm interpreting. Would one of the panelists like to explain how the prioritization is done? And this is a critical role. That the self-evaluation is the enormous amount of data that gets gathered. The transition plan is a planning and budgeting document that is largely meaningful if it isn't prioritized. So would one of the panelists like to respond to that?
I can respond to that a little bit. So we do look at the whole list and see, especially where IHCD did identify some things as priority one. Some things were prioritized by IHCD in the review. We also, there were things that, you know, we knew needed to get done. We also looked at places where, so the school has done a wonderful job of keeping people in district. And so I think this year we ended up with in 3 out of 4 of our elementary schools, a wheelchair user. So that put a lot of things up to the top of the list at those locations to be done to make sure we're doing them quickly. So sort of looking ahead at what the needs are of the community. And then also looking at things we're going to be doing anyway. If we're already touching an area and within that area, well, let's say we're already doing work at a certain school, South School. We want to look at what's on the plan what's all on the IHCD plan? I know I'm in that one area already. What else can I tag into this project?
Good points, Janet. Really appreciate that. Anybody else want to jump in on the role of prioritization and how it gets done?
Well, I can offer that when Salem had each department create their line item for compliance issues, it basically shared the burden with every department so that every department would internally make the, prioritize what needed to be done. So there was some balance there, and it was also very widespread.
Thanks, Tim.
The other piece of it is that if any resident came forward with a very specific and immediate need, it would get bumped up according to.
And this was, let me give a concrete example from Salem, and that has to do with accessible pedestrian crossings. And though there is guidance on accessible pedestrian crossings and where they are to be prioritized, the priority that jumps over everything else is when a resident who needs that crossing to be safe in their community requests it. So just an example from Salem, but it applies everywhere. I mean, one of the things I want to make sure that everybody is aware of, because we didn't actually spend a lot of time emphasizing this, the number one responsibility for Title II, so public entities with responsibilities under the ADA, their first responsibility is programmatic access. And that is really what gets prioritized, other than absolute safety issues at the top of the list of priorities. So it is a sequence of priorities, but those are the first. You have to make programs accessible by either renovating the space, moving the program, or providing it in a different way. Anybody want to comment on that? Because it's an absolutely central issue for ADA transition plans.
I'm just going to say, you said that perfectly. What those three pieces that you just said were just perfect, right? Like the programming, where you're going to have your programming, and if it's not accessible, you either make it accessible. If you can't, you have it someplace else that is accessible. Do you know what I mean? And that sounds so basic, and it feels like something we should all know. And I don't want to insult anybody's intelligence here or abilities, but it all goes back to what I said before, Valerie, and I've told you, it's all about awareness, right? And if you realize
it is. Thank you, Lisa. And I think one of the things that we want to be very clear about is that this process in an ADA of self-evaluation requires that you identify every programmatic offering that you make to your residents. And it is the crosswalk to your physical environment that is the task that has to be undertaken. And it's a tedious task of point by point, figuring out, is it okay where it is? Does it need to be renovated, or can it be moved, or can it be provided in a way that is different from a physical environment? So it is complicated. I hope we've answered that question. Certainly prioritization is one of the most central issues in doing a good and effective transition plan, which, thank all of the presenters, have affirmed it must not live on a shelf. It's really important. We have somebody who's asking, Brian Schamberger is asking about how the agency is addressing barriers related to pedestrian facilities, sidewalks, curb ramps, pedestrian crossings, etc., and transit stops, if applicable, within the public right-of-way. And I actually am not sure public right-of-way is an option on transition plans in terms of scope of work. Everyone does not do it. And I'm not sure if any of the 5 towns who are presenting today did your public rights of way. They are in a separate category from the ADA. The ADA has very limited provisions for public rights of way. That was designated to a separate committee on public rights of way that people thought would last a short period of time, and lasted, I believe, something like 9 years. But those guidelines are out there. They've been incorporated into standard traffic guidance to some extent, but we are hoping that they become a mandatory part of the ADA. Anybody want to speak to that from the panel?
I would gladly make a comment. This is Michelle Tyler in Randolph. when I was preparing a request for procurement to conduct our ADA self-evaluation, I learned that our Department of Public Works had separately and independently budgeted for this review of the public rights of way. So they actually hired an engineering firm, and as luck would have it, before we started our self-evaluation plan, they already have a plan that evaluated all of our public rights of way for sidewalk, accessibility, ramps, curbing, etc. So that piece, thankfully, is done separately and being addressed, and actually some additional funding, because we do have state roads running through our community, and they're now on a paving management plan, which will then address some of the incompatibilities with accessibility. So we're very lucky to have these plans go in tandem, but one that I did not incorporate in our evaluation plan.
Thank you, Michelle. Just a note on that. One of the tasks that is something that can happen is that the method of prioritization for public rights of way requires considerable sophistication relative to your ADA responsibilities. So in a couple of cases in the last couple of years, we have actually taken those engineering plans and with the client's request that they be folded in order to align with the prioritization. So that's one of the tricky pieces about prioritization of public rights of way. I hope, given our limited time, that we've got at least some progress on that. More questions on public rights of way, intersection sidewalks, critical pieces. The standard review covers basically the public area from points of arrival to a building. And that is very limited. It is not going to tell you whether you've got a really serious problem in the public rights of way. And part of the public rights of way prioritization has to do with obviously all public buildings, but we would also suggest that places of public accommodation, and hopefully that bureaucratic term of the ADA is meaningful to the attendees, but that also is a responsibility of the public entity to ensure that there is an accessible route. I'm going to move on to another. In addition to having an ADA sign off on event permitting that Barnstable does, why isn't an ADA sign off required for building permits, occupancy permits, right-of-way permits? Wouldn't this confirm town/city has reviewed specifically for ADA issues and limit issues after the fact? Boy, we'd love to limit issues after the fact. Are those ADA requirements the responsibility of the applicant, and the town/city would take that on, that sign off for liability reasons? Anybody want to pick up that one on the panel, please? This notion of, embed it into practice, make sign off for compliance with the ADA on everything that the municipality produces. Would anybody like to carry that? And how does that happen?
Hi, this is Tammy Cunningham from Barnstable, and I'll start by saying this. I am not a building commissioner, so I will not profess to know the building code and so forth, but this is a dialogue that's happened in our community in terms of our ability from a code enforcement perspective. How can we actually mandate, if you will, or ensure compliance with businesses and properties that are open to the public, that they are fully accessible? And the building commissioner, through conversation, has identified that they do have a limited scope, in fact, regarding the ADA under the Architectural Access Board, as well as the MGL building code enforcement laws that they have to deal with. So they do enforce to the best of their ability what they can. I know that towns and cities have an ability to go over and above that through different zoning requirements, as well as code requirements and things like this. There's been some thought in our community to do something not to the full length of that, but a hybrid, if you will, of a greater amount of enforcement and allowing inclusive and that universal design, if you will, But I know that it is a delicate subject matter for the building commissioners just because of what the law allows them to be able to do and not be able to do. It's a tricky subject, quite frankly.
Thank you, Tammy. I think it's often unfamiliar to people that the building inspector is not reviewing for ADA at all. They are reviewing for code. And ADA is not code, it's civil rights.
That's a good point, Valerie. I'm Paul Logan from the town of Barnstable. And what Tammy just touched upon is so true. And I guess it could go back to the discussion earlier by the 5 cities and towns included here today. Not all ADA coordinators have the exact same training. They're not all created equal, so to speak. And by equal, wouldn't it be great if they work to the letter of the code, as we all know, inclusive / universal design. And all building commissioners / building inspectors in cities and towns are not built equal. And it can be very frustrating. Certainly the rules and regulations within each city and town, as well as in each of the states represented here today. But certainly, if you can do, as Tammy said, and that's go above and beyond, and that's actually, you need that buy-in. And building commissioners are not created equal.
All excellent points, Paul. I appreciate that. One of the things that I think is important for municipalities to understand is that you have fixed responsibilities, and state code exists outside of any of these processes. But one of the tools that you have as a public entity is to use policy as a way to drive a bigger commitment around accessibility and inclusion than is necessarily meeting the letter of the law. And it's a tool that is too seldom used. I'm going to move on because we've got 26 questions now. How should our Commission on Disability interact with the regional high school of which our town is a member? This is a common situation across the nation. The campus is within our town borders, but the high school is a separate government entity from town government, separately elected school committees, separate budget, apportioned among the member towns. When we did our transition plan, we did not include the high school. How should the high school be included in this process? Does anybody have experience with this? Can you speak to familiarity with this issue? It's a commonplace issue. Does anybody among the panelists know this one?
This is David Hopp. I'm not going to say I know it, but we are dealing with it right now with some major concerns about a new vocational technical high school that is actually not honest. That basically we're part of the district that it serves. The reality is we have relatively little control over it. We've had really struggled. Garen and I could probably go on for the next half hour about the issues there, but there's some significant accessibility concerns that have been expressed. But because they're their own entity, they're not part of our own city government. It really has been a challenge. I don't know, Garen, you want to add anything there, but yeah.
Yeah. I mean, just, the experience has been really eye-opening in that we don't have, even though we are a represented district within that school, we don't have much clout as far as, and they do have some very, very major ADA issues that need to be addressed.
I'm glad this issue came up. I don't think there's any simple answer to it, but it is something that comes up all the time, and people feel quite powerless in the face of this distinct public entity. And it certainly warrants more consideration and more attention, perhaps a further conversation on that. I'm going to move on to keep going with our questions because we have so many. Kay Bell, activist from Sudbury. Don't 2 coordinators make sense? ADA coordinators will read there, with specialization in the 2 distinct areas, the built environment and policy, procedure, programming, communication. These are such different skills. I mean, I think we frequently recommend that, Kay. There is no obligation to have specialty ADA coordinators. We have sample job descriptions that describe the responsibilities, the essential functions of that job. Unfortunately, so few people are even half-time devoted to the role that it is difficult for anyone to juggle all of these. And I think there are opportunities for discretion to prioritize the ADA coordinator to be able to meet all of this adequately, and that might be done with 2 positions. Moving on, our city is locating its ADA coordinator function in the Diversity, Equity, and Inclusion Office, in part because of our advisory role / purpose, but we don't have construction or budgetary control. Any advice for this setup? Can anybody speak to that? I think this is a really interesting issue. This is happening outside of municipalities. We're finding this is happening in 2 other big categories of familiar work, and that is in museums and in higher education. Would anybody on the panel like to speak to this important issue? Identify yourself by name first, please, and in town.
This is Deborah Lopsitz from Salem. One way of approaching this that really doesn't require having any regulations or rules in place is just to cultivate have every individual in the Commission on Disabilities and the ADA coordinator cultivate an open dialogue with all the parties involved. You know, you don't necessarily have to put someone in place to supervise activities, but if you can send out that network of connections and just keep the conversation alive about it, that sometimes is sufficient to push through the barriers. As I said earlier on, the Institute for Human-Centered Design presentation in our community served to really wake everyone up and get the word out and educate the people who have involvement in these issues and situations. You know, it got everybody to buy in. There was no special position created. There was not an additional person brought on board. We just took advantage of connecting with all the other departments and keeping that solid and keeping that conversation with them.
Thank you, Deborah. I do want to share with people that federal policy is actually DEIA, and David Half had mentioned this earlier, or disability, equity, accessibility, and inclusion, I think is the better sequence, DEAI. It is the policy of a variety of other large institutions, and it's increasingly common in additional major institutions. We actually think it can be a major asset. I think the issue that the questionnaire is stressing is that they may not have any authority over things like capital projects. And I think this is something that's going to evolve. We're actually finding that in many cases, not necessarily at the municipal level, but in the institutional level, we're finding that DEAI personnel are often quite senior, and they do have a level of authority that gives them a span of influence that is very desirable to be within. Our sidewalks programs. Sidewalks are vehicles to get to programs, so sidewalks are pretty darned important. Where do sidewalks fit into program accessibility? Another question. Can sidewalks for exercise be designated program accessible? I don't know if anybody has an answer to that one. That's an interesting question. Obviously, walking is the cheapest and best exercise one can get. Difficult to do in areas without good sidewalks. Anybody want to comment on that?
I'll take a little bit. Just when we are creating sidewalks, we try to make sure that they are ADA compliant. As we know, sidewalks along the roadway is a little different than sidewalks within a space. So sidewalks along the roadway can follow the topography of the land, but sidewalks within we just did a sidewalk from a parking lot to the municipal complex. We made sure that the entire way it was below that 5%, so that it should be accessible. So I think there's sort of a line drawn between street and site.
Actually, part of what I think is just worthy to remind people of is that the public rights of way guidelines are still not a mandate, but the ADA never really went very far with sidewalks and public rights of way, and it is an extremely low measure. So in terms of policy, a great many states have adopted a policy of using the public rights of way accessibility guidelines, so that is often picked up by municipalities as a tool they use to go beyond the very limited requirements of the ADA.
We're really lucky in Melrose to have a very active bike and ped group too. So a lot of issues along sidewalks, roads, you know, from a walking standpoint as well as a biking standpoint, get risen to us through the Bike and Ped Commission. So we're very lucky and fortunate to have a group like that to be focused on right away.
And I think part of what everybody is concerned about these days is how to make all of the multimodal ways of getting around. And I think all of us appreciate that multimodal has its place, whether that's cycling or you know, including electric bikes or scooters. And I think finding a way for all of us to live comfortably in safety with that mix of new products that are on the street is important. So that I think is just a piece of what the future holds, that we're going to have an endless number of things. And I think finding a way where there is respect for, particularly for people with disabilities in the public right of way, who don't necessarily hear you when you yell on your left, or be able to see you when you assume that someone can see you. This has turned into a very significant challenge, particularly with the proliferation of very small vehicles for making your way around. Any comments on that from the team?
Just would like to add to the conversation. I have a different hat that I wear from this community, and I'm sorry, Michelle Tyler in Randolph. As the planning director, I work directly with our planning board. I don't know what state the question originated from, so some of the terminology I may be using is specific to Massachusetts, but at least in Massachusetts, in a municipality, a planning board has oversight for the development of private roads, including the sidewalks in those private roads. So it is this elected or appointed group of people, 5 to 7 people, who are determining where a new street is constructed, what the width of that street is. Is there one sidewalk? Is there 2 sidewalks? Is there granite curbing? And so that board has that authority to do that. So again, if we go back to some of the overlying conversations we've had of policies, municipal policies and practices being extended to all boards, committees, and commissions, that can ensure it. And having that knowledge and awareness. A developer is going to come to the planning board and say, oh, it's too expensive for me to put in a sidewalk.
Yeah.
Way too expensive. It is not. It might mean that their return on investment is a little lower, but that's up to that committee that represents the community at large to ensure that there is installation of a sidewalk that is accessible within that right of way. So it's not limited to municipal government, the town hall folks or the Department of Public Works, but it expands out to whether it's zoning board of appeals or planning board or another regulatory board that you might see in your municipality.
Very helpful, Michelle. Thanks very much. This is Valerie Fletcher again. I just want to stress that there's a lot of interest in this public rights of way question, as it is appropriate to see. A reminder that 10 times more people in the category of people with disabilities, with mobility disabilities, have difficulty walking. And those are people with bad backs, bad hips, bad knees, bad feet, may or may not be using an assistive device. And our failure to tend to our sidewalks and rights of way is really a failure to serve an enormous portion of our population. A question here, another question, this is actually from our friends at the Vermont Center for Independent Living. One thing overlooked in making sidewalks accessible is that overhanging tree branches are not trimmed, a hazard for blind people. That is absolutely covered under the ADA. No debate about that, and it covers all paths of travel. So if there is overhanging vegetation, that is a violation of the ADA, and you should be able to take action. Any comment from our panelists on that one?
This is Deborah from Salem, and in Salem, we actually have an app called See, Click, Fix, where
Perfect.
where you can report any barriers like this when you come upon them. Blocked sidewalks, bushes that have grown into the sidewalk, cracked, and sidewalks that are in such disrepair that you can't navigate over them. So it's usually the Department of well, actually, I'm not going to say because I'm not exactly sure, but reporting such barriers to the city is obligated to address them by notifying the homeowner or the person responsible for that property that it needs to be addressed. And these are such easy things to fix.
Yeah.
Now, I won't say any names, but there are some individuals in the community who just take it upon themselves to clear those ways, but I'm not recommending it.
Thanks, Deborah. No, we're not out to break the law. One of the questions that came up earlier in the chat had to do with the lack of conversation today about people who are blind and low vision. And I think we really need to speak to that. One of the things that is an absolute constant, we haven't done a job ever where signage was not an issue. And nobody actually brought that up this morning. So I think we need to take a minute to talk about signage because it is absolutely critical for people with vision limitations to navigate the world. It's also increasingly clear that it is critical for the large proportion of people who have brain-based reasons for disability to navigate the world, reliable, accurate signage. But the particular issues of the ADA requirements on signage is too often poorly done. So would anybody like to speak to that? Because everybody had elements of their transition plan that addressed gaps in your signage compliance. Anybody want to step up on that?
This is Tammy from Barnstable. And I'll just say that through our process, this was certainly an element that raised a tremendous amount of awareness with our community. We were definitely lacking in the area of signage. And so all of the comments and feedback that were provided to us by IHCD was incredibly valuable to us because it offered really a perspective in an area that we were incredibly deficient and we needed to be better with. And there were really just some glaring things that we never saw, like, for instance, signage into town hall, no glare and no braille that was written on our bathroom signage, lack of signage in areas that it should have been very obviously noticed but wasn't. And so it's certainly an area of focus for our organization where we're trying to be better, making great strides, but we're not there yet. But if anything, it invited dialogue into this discussion about signage and brought about the need to be better in this area.
And I think, Tammy, you actually in the town of Barnstable represent a wonderful opportunity to stress that the highest rates of vision limitations occur in people over 65, and critical issue in Barnstable. Tremendous benefit for older residents when this is well done. We have a question that I'm going to actually have one of our ADA technical assistance teams pick up, our team members pick up. City of Glendale, Arizona has recently been asked to interpret accessibility requirements for new electric vehicle charging spaces. Has any other municipality addressed this issue? There is guidance on that. Would Stacy or Jason step up on that one, please? Or can we elevate them to be able to speak, PJ?
Hi, this is Jason. I'm an information specialist at the New England ADA Center. I am a white male. I wear glasses. I've got a green shirt and tie on today. So for the electric charging stations, it's an interesting intersection between new technology that's emerging and working with the standards that have been in place for ages. So what the US Access Board has done is created an electric vehicle charging station where they've pulled out the important aspects of the 2010 standards for accessible design and applied that to not only just parking, but electric vehicle charging stations in that regard.
Jason, could you post that in the chat, please?
Absolutely.
Wonderful. Thank you. Thank you. A clarification on sidewalks and paths of travel, because there was a question about, and again, the always scrupulously attentive Kay Bell, accessible routes to ball fields are pointed to in our transition plan. They are program access priorities, and that's absolutely true. And one could, kind of guess, why can't sidewalks be that? Since you can't get to anything if you can't walk the sidewalk. It isn't actually structured that way. The path of travel to get to a program is indeed covered, and that's clear. But sidewalks are, as a critical part of the material of our physical lives in municipalities, does not have quite the same stature. We certainly hope the public rights of way guidelines become a requirement so that there can be far less ambiguity about this in the coming years. Could I ask each of the presenters to take a minute for a last comment? Please, just, you've got to have a last comment. You're all so articulate and so passionate. I have to ask if each of you could take advantage of just a few more minutes and offer us your final comment. Why don't we start as we did the day? Let's put Tammy and Paul on the spot to start with.
I would just say that if anyone has any questions or is looking for some helpful guidance and supports, to feel free to call me at any time. I think we all need to support each other in our journey in creating a more inclusive and accessible community for our residents and visitors. And we're going to achieve more if we do it together and support each other in this journey. So if I can help anybody, please feel free to call me at any point in time. I'm happy to talk with anybody, and best of luck to you with your work.
Thank you, Tammy. Terrific. Let's go on to Michelle Tyler from Randolph.
Thank you so much, Valerie. I would have to say that this webinar has probably been as much of a learning experience for me today as my other learning, whether it's from my colleagues around the Commonwealth, from your questions in the Q&A, or the comments in the chat. So I thank you all. This is a journey. I've only just started the journey. And my goal, again, is to not have a plan that sits on a shelf collecting dust, but that actually is active in the town across all of our municipal departments, boards, committees, and commissions. So I thank you all for educating me today.
Thanks so much, Michelle. And now Lisa has had to leave, but Deborah Lopsitz, chair of the Disability Commission in Salem, will have a last word.
Well, the most important last word is thank you. Thank you all so very much for your contributions. This is very challenging, but extremely rewarding work. And the fact that we do it together and that we're always learning from each other is very impressive. There is really no end to educating yourself on the topic. And the more you know, the more helpful you become, because as a single organization or agency, you can't do everything, but you can know who can pick up where your jurisdiction leaves off. So just thanks so much for all that I've learned today, and keep that process going. And I am very confident that you all are making the world a better place.
Thank you, Deborah. David Hoff and Garen Boyd, can you step up and offer us a last word from Melrose, please?
So this is David. I just say that if there's any way possible you can do an updated transition plan, do it in self-evaluation. It is an incredible way to sort of just lay out the issues and move forward. I cannot emphasize enough, for a relatively low cost. I mean, again, we're still in the early part of this journey, but I just cannot emphasize enough how really it's just so of such value. And I would just urge other folks to, work with your municipality to make the investment, find the funding to do it.
Thank you, David. And Janet Nicosia from the town of Arlington. I mean, what am I saying? With Arlington, the town of Andover, the beautiful town of
Andover.
Andover.
Yeah, just thank you. Great to meet all of you and see all the people attending from all over the country. It's really humbling. And thank you all for the work that you're doing for people with disabilities. I'm honored to be among you.
Thank you, Janet. And I will leave you with one phrase. Those of you who are familiar with the work of the Institute for Human Centered Design may know that we have a keen interest in the changing reality of disability in America, particularly as it relates to different kinds of disabilities and the impact of disability, the intersection of race and culture and gender, for that matter. And I urge you to look at that in that report and in that documentary, which was produced by our producer today, PJ Moynihan of Digital Eyes. Not everything that is faced can be changed, but nothing can be changed until it is faced. James Baldwin, of course.
Yeah.
But really applies to our efforts today.
Absolutely.
That if we don't face it, we never get there. So hearty thanks to everyone who participated in every possible way. It's been a terrific experience, and we are deeply grateful. Warmest good wishes for a great spring to all.
Thank you.
Thank you, everyone.
Thank
Have a
you
great
all.
day.
Bye-bye, everybody. Thank you.
Thank you. It was wonderful. Great experience. Thank you so much.